Hope you all had your breakfast. We shall begin our sessions today. It gives me immense pleasure to stand here on behalf of our KSOGA family, Tumkuru Society of Obstetrics and Gynecology family, to extend a heartfelt welcome to the wonderful gathering of brilliant minds in the obs and gynae. The field of OBG is the one that transcends the limit of medicine. It's an art, a science, a journey, telling the stories of miracle, the strength of womanhood, and silent courage behind every woman's smile. Now, as much as me, many of you might be wondering what is aesthetic gynecology? What can be aesthetic to a woman beyond beautiful face and smile? Or hairs, isn't it? It's the self-confidence. That's the most aesthetic thing a woman can wear. So now, aesthetic gynecology is an upcoming and innovative field of medicine, a branch of our very own OBG, which deals with innate beauty of the women, addressing the real intimate concerns of the women, which arise of childbirth, aging, and several things. And it's most often overlooked, and the field of aesthetic gynecology is here to deliver promising results, enhancing the quality of life, and most commonly, uplifting the self-confidence of the women. So, dear delegates, the day is set, the moment is here. We have open minds ready to learn, the national experts and the machines delivered from Germany to Delhi, Delhi to our own Tumkuru. I welcome you all to this wonderful gathering. I now welcome Dr. Poonam Mishra ma'am. Poonam Mishra ma'am from Lucknow. She is the President of Indian Society of Aesthetic Gynecology. I also welcome Dr. Anupama Sethi Arora from Tulip Hospital, Sonipat, Delhi. I welcome our chairperson, Dr. Kasturi Hodonimat from Talvadarsha Hospital, Hubli. I also welcome our arriving guests, Dr. Shobha Shavi, Dr. Sheila Mane, Dr. Gnaneshwari, Dr. Priya Patil, Dr. Bharti Rajshekar, and all our national experts and our state experts being seated here. This gathering is not only about academics, it's about connection, the collaboration and celebration. With respect to time, we'll begin our session. Few points to keep in mind, dear delegates. There will be question and answer session after each talk, and we'll be encouraging 2 questions per session. And all the speakers, your mementos will be handed over to you in the Hall of Fame. I now invite upon Dr. Anupama Sethi Arora ma'am to deliver her talk on magical power of lasers in optimum feminine wellness and lasers in gynecology. Over to you, ma'am.
Good morning, everybody. Welcome you all to this Cosmetic Gynecology Workshop. It's very, very important, I think the need of the hour. It was the most neglected part of the gynecology. Everybody, it was taken a back seat. But nowadays it is taking a front and forefront seat, and in due course, in few days, it's going to be a super specialty in OBGYN. So, creating awareness about this cosmetic gynecology among the doctors, among the gynecologists, and among the public is a need of the hour, so that we can pass on the benefit to the patients. So it's my proud privilege to introduce Dr. Anupama Sethi Arora. Madam is a senior consultant and endoscopic surgeon and IVF specialist, and specialist in urogynecology surgery, and she is director of Tulip Hospital and TLHS course director, TILLT. She has more than 40 publications. She has delivered more than 60 guest lectures and trained more than 3,000 gynecologists in the field of laparoscopic gynecological surgery. Video presentation in many of the national and international conferences like AAGL and RCOG at Singapore and Amsterdam and Netherlands at RCOG UK. And she has received many awards. Sakaratmak Socho Ka Samman Award in 2023, Doctor's Pride Award in 2023, Best Endoscopic Surgeon Six Sigma Award in 2015, and Parakshak Award in 2021.
Thank you.
It's pleasure to have you here, madam. Over to you.
Thank you very much, ma'am. Good morning, everyone. Today I'm here to speak with all of you in front of you for cosmetic gynecology, because this is one field I feel that is left behind, and all other fields, because I am also in the age of 50s, so everybody wants to look good and to have that aesthetic feel, which we actually have problems. So cosmetic gynecology and aesthetic gynecology, they go hand in hand, because it is the aesthetic part which is mostly required to do mainly because of the aesthetic part we are having problems. So now I'm starting with the lecture of my laser. So cosmetic gynecology is a dream, or is a functional reality. Age is not a barrier to feel yourself again, reclaim and restore your sexual health. What is beautiful and what is ugly, we all know this. There's nothing in it, but how female feel body shamed means a lot of percentage. Like as soon as you go to menopause, a lot of patients, all of us, weight gain along with urinary problems. As a urogynecologist, I feel those problems have to be, looked into. And that's it. So women is increasing in number, are choosing to alter their facial shape, genital anatomy to gain greater self-esteem, diminish functional discomforts and difficulties in improvement of sexual pleasure. So here we come with the aesthetic gynecology as the current one of the most important area of developing of gynecology, has been increasingly in patients' demand as well as in physician demand. It is a set of procedure that aims at eliminating the mental and health consequences resulting from changes of genital organs due to childbirth, due to aging, due to improvement of external and attractive external genitalia and improving their functions. Most important is improving the functions of the genital areas with age. It is imperative to have an insight into the burden of a female sexual dysfunction and related disorders globally and the treatment available. So now women are empowered with the choice to change the external appearance as well as the functionality of the vulvo-vaginal region with laser, which is giving them a lot of encouragement as well as lot of self-confidence as patients we get. So the game changer. So all of us know surgical techniques for urogynecological problems we have. So aesthetic, this type of an aesthetic is totally a game changer, because a lot of energy devices are there in the market which are causing natural reversal of the aging of the cells. With the help of energy devices, it actually helping the geriatric population and particularly the postmenopausal patient. There are a lot of versatile properties of the energy devices, which is cutting, coagulation, vaporization, ablation, diagnostic and regeneration. So Now because as you all know, the energy devices which are used is HIFU, RF, you have so many energy devices, but we are here talking today only of laser. Because laser is one thing which I have felt has made a lot of change in my practice. Being a busy gynecologist also, I think that is a thing which is required, especially the urogynecological problems. Laser causes less tissue damage, reduce bleeding, promote rapid healing, minimum scar formation. This is an OPD procedure and with a microscopic procedure. Laser is used for both conventional and endoscopic as well as microsurgical procedures. We all know, we've all used laser. Most of the lasers are CO2 or ND YAG laser. CO2 is used for colposcopic procedures. We have already been using this, and for laparotomy and major where minimum depth surgeries are required. ND YAG laser is basically used for deep coagulation and active, that's a solid laser with good crystalline strength. So what is laser? Have we ever asked? Laser is light amplification by stimulated emission of radiation. Okay, how does this occurs? Because laser actually takes its name from the medium which is used to conduct the laser. That is the thing which is used. Okay, the difference between a laser and a bulb, laser beams are of the same wavelength, move in the same direction, same color, no divergence, and they're all in one place. Okay, this is what is laser. Means it's a light which is monochromatic, collimated and coherent. Means the laser works on the principles of quantum mechanism. So what do we mean by monochromacity, coherent and collimated? Monochromacity is that the light beam of a particular laser have the same wavelength. Means all troughs, like if laser is being used, we are using a light which has same monochromacity, means all troughs and down are in the same direction. Second way, light waves are perfectly aligned and are unidirectional. And third is collimated, that these light beams run parallel and they do not diverge. So the moment you have laser exposure to the cell in water, the cell is boiled to about 100 degrees centigrade and then the cell exposes and vaporizes. The preferential absorption of the laser occurs, it's a lot of physics which you have to know, because I don't know, sometimes I used to feel that I should know what is laser. So preferential absorption of laser from one tissue to other is known. So laser beam can be converged by a convex lens to a sharp focus in form of a spot. You've all seen that. I don't have a, yeah, I think this is the laser. See, this is the laser. See, so it is converged by a convex lens in a sharp focus. That is laser. So laser are in that they are coherent, same phase, same wavelength, colors is same, and there is no divergence. They all work parallelly. So laser is high energy, which is with stimulated emission, which can be sharply focused, so more hazardous than the normal light. Normal light is divergent, polychromatic, spontaneous emission, low energy and non-coherent. Means आपको ये पता है, to tell you very frankly, that if you focus your light in a spot, you give maximum energy in that spot, and that's where the result comes. Normal energy, we are sitting in light, there is nothing is ever is happening other than heat. But if you have a light which is monocoherent, monochromatic and collimated at one spot, you will get results. So laser is a wave or a particle. It is a particle which goes into the body and interacts with the host tissue. There are a lot of lasers, and depending upon the media through which the laser is passed, that is gas, if it is media is carbon dioxide or Nd:YAG, or semiconductor like diode or liquid. I'm talking a lot of physics, but yes, you should know this physics. Okay, so all lasers are primarily composed of 4 components. One is the medium, that is very much on which it depends upon through which medium we have to go through. Then optical cavity, power supply, and the delivery system. There are a lot of laser interaction, laser tissue interaction means lot of variables in laser, means the wavelength, the spot size, the power, and the exposure. And tissue variables are, all of them are there, which is transparency, pigmentation, water content. So depending upon the wavelength, spot size, depends, depending upon the wavelength, actually depends the spot size. Effect of laser beam on a tissue can be photothermal, photochemical, or photoacoustic. Versatility of laser is defocusing, cutting, causing cutting, vaporization, and coagulation, depending upon the tissue absorption, means whether it is hemoglobin, melanin, connective tissue, water, by the various lengths of the laser. So actually laser depends on the wavelength, and this is a thing which is to be known. Carbon dioxide laser is it is least penetrating and cause minimal lateral damage, hence it is used for delicate areas. It means it is a ablative laser. Ablative laser means it is actually working on the skin and the subcutaneous tissues. If you ask me about the Nd:YAG laser, it penetrates to the depth, that is 3 to 4 mm depth it penetrates. It has to be carefully, poorly absorbed by the fluids, and hence it's an excellent tool for hysteroscopy. And last is the diode laser. Diode laser, the depth of penetration is 1 to 3 mm, but can be used to, there can be wavelengths, different wavelengths starting from 800 to 1400 wavelength. And depending upon that, it has got different ideas how it's working. This is a tissue interaction thing. I'll show you the other thing. So now, as it goes through the medium and it goes to the tissue, how it interacts. This is the wavelength. Okay. So if this wavelength is there, this is mainly absorbing by the melanin, and if more than that you go, you have tissue wavelength, then it is absorbing the water content. Okay, so laser eradicates, because whenever you give laser to any tissue, it is either reflected back, it is absorbed, or it is transmitted. So whenever there is laser beam impact on a tissue, a crater is created, smaller than spot, greater than the depth of the crater. The tissue is maybe a lot of, I'm not going into details, but yes, it creates a crater. Okay, so I'm not going into details, but yes, this is the way laser acts, and through the delivery system, it acts as a fixed beam or fiber optic delivery system. So actually what happens, the moment the laser gets into tissue, it causes superficial vaporization, creation of microthermal zones, deep thermal effects. Mucosa has a high content of water, so selective laser works, because if you ask me, so It depends upon what kind of a laser. Ablative lasers are ND-YAG laser and CO2 laser. Non-ablative laser, which we are talking about more these days, is the non-ablative laser, and that laser is the diode laser. And the wavelength varies from 890 to 1470. It depends upon that how do you, which work you have to get it done, and it actually depends upon the water content of the tissue where you are working. So this is all shown like this, okay? So now I come to use in gynecology. I've talked too much of physics, though it was required or not required, I'm not sure, but yes, it is used. So we will be using laser in gynecology. Now, in laparoscopy, you use it in CIN, condyloma, warts, endometriosis. Cosmetic gynecology is another field which is picking up. 20 years of use, safety of lasers is definitely, it is very safe. There is a lot of training and understanding is used, and it is, these are the things. Advantage of the laser is less painful, reduced need of anesthesia, reduced hospitalization, minimum tissue damage, minimum bleeding, reduced risk of infection, and minimal tissue damage. Okay, so future of laser is here in gynecology. So we use laser in gynecology. One, in endometriosis we use. Then in fibroids also we do endometriosis, this laser is used. Then in ectopic pregnancy for salpingectomy you should also, maybe for linear salpingostomy we use laser. And laser are used for ovarian cells, polycystic ovary disease, photodynamic therapy, VIN, vulval intraepithelial neoplasia. So these are the various ways how laser is used. Now we come to our topic of cosmetic gynecology, because it improves the quality of life, sexual wellness, aging population which is desired to be fit, GSM and SUI and cosmetic procedures are also gaining weight. How do laser work in cosmetic procedures? As surgical handpiece, as a tool of regeneration, same machine can be used. Never machine have various, like it has got various wavelengths along with that multiple probes. So now I'm talking about basically diode laser. Diode laser is used mainly in cosmetic nowadays more rather than CO2 laser or ND-YAG laser. And these machines have dual wavelength, and hysteroscopic procedures are also done with that. Now, what problems do we have? Aesthetic problems we have, as we have urinary vaginal leakage is there, then laser vaginal regeneration, dryness of vagina, repeated infections. This is what I want you, all of you, these are the main urogynecological problems as we are all facing these days. So major issue is that 80 to 90% of the patient women are suffering with vaginal atrophy, 50% of the women are suffering from SUI. So the truth is that 28 million females have urinary incontinence, 15 million patients have urinary stress incontinence. And for me, laser is a boon for me, because as a urogynecologist, you get patients with SUI, you have mild to moderate SUI, we use lasers. In severe SUI, we do either Birch or we do use TOT. This is the main. But then the patients come from with vulvovaginal symptom, atrophy symptom. Sometimes, you know, patients come to us with frequent passes of urine. They don't know, and there is nothing in the vagina. And they are the patients with vulvovaginal atrophy symptoms. 50% of women suffer from GSM symptoms 4 to 5 years after menopause, including dryness. Then vaginal laxity. Some patients will come and tell you that something is coming out. But what? We examine the vagina, there's nothing there. And to give them relief is laser will give them relief. I have used it I've used it like 3 years, past 3 years I've been using for GSM, for SUI with good results. Then you have recurrent vaginal infections. Sometimes, you know, a patient is coming with recurrent vaginal infections and their introitus is also not huge, and you have actually, you don't know why she is getting infections. That is because of the laxity of the estrogen in her vaginal mucosa. And that is the thing which is causing majorly problem. So it is actually vaginal regeneration which has to be done. Okay, so the solution is that surgery will take longer, physiotherapy or exercises. We've all been using Kegel exercises for years now. Then non-surgical lasers are quick and effective. Okay, in total, we have to go for energy-based devices, laser, and as well as RF therapy or the HIFU. Okay, now we come to the histology of the vaginal mucosa. Vaginal mucosa is basically, it is superficial, like we all know this, that it is composed of 4 layers. The mucosal epithelium is estrogen dependent, and over 3,000 estradiol regulated genes are involved in vaginal repair and remodeling. After menopause, estrogen decreases, and that decreases the collagen, and fewer blood vessels cause genitourinary syndrome of menopause. Collagen is very important for the strength of the urogenital tissues. This is the way how you choose all this. Superficial layer, mid-zone, and the parabasal layer. So what is laser? Laser is completely an outpatient procedure that is performed without anesthesia. It is non-invasive, effective, and painless treatment with no side effects for vaginal regeneration and SUI, and no ablative effects on vaginal mucosa. This is how we deliver laser. This is a 360 degree. So the laser is given continuously at the same level, 360 degree, while we take it into the vagina and we come out. Okay? So it is, the delivery systems are single use, reusable, 360 degree or 90 degree. And where can we imply? We can imply in patients with vaginal regeneration and tightening, SUI, urinary incontinence, vaginal atrophy, recurrent infection, GSM, along with the treatment of scars. Exclusive non-ablative mode causes a spot size of 6 mm. It is safe and short, painless, broadens your clinic reach, added with value to your practice, and safety wise it is set. A protocol that use infrared laser in order to accelerate the production and remodeling of mucosa collagen in female genital organ with ongoing atrophic process. It is not adequately treated. It may result in dryness, sexual difficulties, and all the problems. So non-ablative lasers are used for vaginal regeneration, for SUI. Okay, because it causes, the non-ablative lasers leave the tissue surface intact, decreasing the side effects, produce deep pulse heating, vaginal wall heating, causing remodeling of the epithelium and collagen. Heating up it up to the 65 degrees is the main thing. The collagen is heated up to that, and it causes shortening of collagen, resulting shortening of the mucosa, and neocollagenesis is done. So this is really an important way. So first, what is in first way, tightening of the collagen and neocollagen after non-ablative diode laser. The first phase is the photothermal, that is the tightening of the collagen and breakage of the bonds. This is the first phase of after laser. The second phase comes 3 to 4 weeks after the first session, which is the neocollagenesis. Immediately, patient feel relaxed. Patient feel shorter fibers in about 30% of the patients. So photothermal effect of the laser based on the thermal dose is really causing cell activation, neovascularization, increased connective tissue in tissue, and promoting cellular repair. So all these things are for diode laser. 1470 is the actual diode laser we are using these days, and you have to take a consent laser, then check the machine, look for the fibers, look for the eye protection goggles, have a handpiece, and that's it. And you clean the vagina, and then you insert the your equipment inside the vagina, and slowly, as you've been told, it is emitted. Laser is emitted through that handpiece. Okay, you can all look for that handpiece here, and we can use it. Insert the vagina gently into insert the probe gently into the vagina, reaching the cervix. Active laser by pressing the foot pedal. Continuous withdraw the handpiece while withdrawing. Patient feel little sensitivity near the labia majora, and the amount of energy delivered during the session should be known to all of us. That's it. Okay, so we have realized that after finishing the 4 sessions of the laser, the coating epithelium has regained its normal thickness, that is glycogenation. It actually creates a lot of inflammation is there, and the moment the inflammation finishes off, there is definitely shortening of the collagen fibers. That is the way we create ourselves. Okay, now it is a faster, efficient, simple and precise method that laser is being used in gynecology for regeneration of the collagen, restore the normal hydration and elasticity of vaginal mucosa. In conclusion, the patient is, you have to tell the patient that this is the procedure we are going to do on you, and you have to tell the results. 30% patient tell the results there and then. Okay, that's it. Thank you very much. I'll go by this one lecture only. I'll just so now I'll specifically speak on laser on application. 5 minutes only, because this is the diode laser we are using. Okay, so this is the diode laser we are using. We are using it for labioplasty, labial liposuction, varicose veins, vaginal dryness. In GSM we are using it for vulval tightening, for SUI and lichen sclerosis. It is approximately a 360-degree laser application designed not to move or rotate, because otherwise, previously the laser which everybody has to rotate this side or that side. You don't have to rotate. It is 360 degree, and it has got a smaller diameter which allows a painless application in the postmenopausal or the lichen sclerosis, narrow introitus. The patient selection has to be really good, and definite indications are GSM, laxity and SUI. There has to be taken a complete medical history, previous any use of such treatments, and examination has to be done. And these are the prerequisites that what you have to, this is actually the checklist which you have to do before a procedure. Okay, indications, as I've already told you many a times, three sessions once in 4 to 6 weeks, means there is for like every 15 days you have to do a session, and minimum 3 sessions have to be given. The joules is like starting from 300 joules at 2.5 watts. We start with it. Evaluate every 6 months. Maintenance session is required after 8 to 10 months even after 18 to 24 months. It is a proven effective OPD procedure, painless. It delivers energy to the tissue. There's minimal lateral spread. Blood rest procedure doesn't cause post-op scarring or adhesions as in laparoscopic surgeries, and it is non-invasive. It is a coffee break procedure. Normally, we tell the patient it is that you are working in the coffee break, come to us for 10 minutes and get the procedure done. It is easy and safe and easy. It has got no anesthesia, faster recovery, well tolerated, no adverse effect. And the most important thing is that it has got slim design. The energy is delivered homogeneously, contactless thermal tissue heating, no rotating of vaginal probe. Vaginal probe can be sterilized, and it's a portable machine. Effects and results: immediate experience of tightening. Patient reports, 30% patient reports that immediate tightness is there. Increased sexual functional scores, improved dyspareunia and all these things. Then there is partial or total relief of mild to moderate SUI and greater satisfaction reported at the end of the treatment. Possible adverse effects could be edema or swelling, vaginal bleeding, vaginitis, mild burns, itching, burning sensation could be there. There are other technologies. Means finally, we have come to this conclusion that diode laser is a fairly simplified way of delivering laser to a female. Small size and compact design allows easier use and access. The diode requires low power consumption, and it is very economical because of its portable properties. Okay, so a healthy lifestyle has never been more important. Correct diet, exercise, sleeping a good sleep always makes the person healthy. Our most important point is that a healthy lifestyle requires a good sexual intimacy, and the couples are intimate till longer age have lesser chances of hypertension, cardiac problems, diabetes, depression, maybe Alzheimer's. These issues are largely ignored by the patient and physician. Hence, there is definitely a demand of these kinds of procedures, though they are on uptake, but in a very slow rise is there. Thank you very much.
Thank you, madam, for an excellent lecture on laser. You cleared all the things right from basics to the use and the advantages.
Yes.
So just one question, what are the real contraindications for this?
Not much contraindications, because we use laser in all these patients unless she has some boil in the vagina, or obviously indications could be malignancy. I'm not been using for anything. I use it for everything.
Okay, maybe some pre-invasive cancerous states.
Yes. Pregnancy is definitely pre-invasive, and that is why you have to take pap smear.
So we have to
you have to take pap smear before taking up the patient.
We have to screen them prior. If they are there, then we are contraindicated.
When we take HVS culture sensitivity also, we do not want to. We give 7 days antibiotic before we do laser in recurrent infections.
Yeah. There is two things. One is severe infection or pre-malignant conditions are the contraindications for this.
Yes.
And one more question I had. Which is the best one among this? Whether the CO2 laser or
diode. I've already told you the usage of diode. CO2 laser is required whenever there is, you have to do surgical.
Okay.
Okay, for surgical, you need to have CO2 laser for labioplasty and everything. But for vaginal regeneration, GSM and everything, diode is best. Yes.
Okay. Thank you so much, madam.
I want to, can you just, इनको ये वाली slide दिखा दो, please? Yeah, I have a course by American Board of Aesthetic Gynecology in my hospital. They are first time doing it in India, otherwise they are usually doing it in Dubai. And you get a diploma in cosmetic gynecology. This is from 14th to 16th of November. If anybody is interested, they can talk to me personally. Thank you very much. And it has been done by all international experts. Thank you.
Thank you so much. Now we call upon Dr. Poonam Mishra.
Anupama ma'am.
Madam is a senior consultant and gynecologist, and she has done an aesthetic
Thank you, Anupama ma'am, for brushing up our physics, taking us decades back, and delivering the lasers into our knowledge through your magical power. Thank you for wonderful insights into the field of aesthetic gyne. Definitely a lot of new minds are enlightened. I now request our next speaker, Dr. Poonam Mishra ma'am, to deliver her talk on electromagnetic stimulation. I welcome Dr. Bharti Rajshekar ma'am, chairing the session. A very warm welcome to you, ma'am. I request Dr. Kasturi ma'am to introduce Dr. Poonam Mishra ma'am. Over to you, ma'am.
Dr. Poonam Mishra is a very senior gynecologist, and she is a director of Manasa Hospital and Manasa Gynec and Cosmetology and Laser Center. She is the president of Indian School of Aesthetic Gynecology, member of Sexual Health and STI Committee FOXY, and organized and participated as faculty in many national and international conferences. Welcome, madam.
Thank you so much, ma'am, for this generous introduction. Thank you so much, and thanks to the audience. Yeah, the hall is so much full. That shows the keen interest into this new segment, cosmetic gynecology or aesthetic gynecology. I think this is... Thank you. So, first of all, I just pay my heartiest gratitude to this KSOGA team, especially Dr. Sheila Mane ma'am and Shubha Goody ma'am for inviting me and giving me this chance. And the topic allotted to me is electromagnetic stimulation and pelvic floor dysfunction. This is something very important, and why this is so important? Being a female and a gynecologist, you all must be understanding the role of pelvic floor muscles, how they are helping us to hold everything above the urogenital diaphragm, the whole uterus, as well as the bladder and the rectum. They all are supported, and once the aging starts after some time because of aging or after childbirth, sometimes girls also come to us in our clinics that a volleyball player came to me, a basketball player, and she told, she was 18 only, and she told that whenever she jumps, she leaks. And this was so difficult. Her life was like, she was devastated. She was telling that, should I continue my playing habits and all? Then I realized, yes, this pelvic floor dysfunction is not only related to the childbirth or aging. This may happen any time, and one should have some treatment. Like what we do some, a patient is coming with prolapse, we are hanging that uterus up. Like we are fixing it, pectopexy or anything. We do fixation we can do. We can lift the uterus, but what about the dilated hiatus? The levator ani hiatus, which goes on dilating, which actually giving way to the structures inside the uterus. So there we need some kind of treatment which should be non-surgical, which should be given to all kind of, like in any kind of female should come to us, should get the treatment, and there should be top-ups also. Once a female can go to the salon for getting her beautification topped up, she can go to a pelvic floor rehabilitation clinic also, and there needs the awareness. We all gynecologists have got the duty. This is a social work. We all have to tell our patients. And let me tell you this cosmetic gynecology, all patients you are going to get from your own obstetric patients. So the way you just counsel for the contraception beforehand during her ANC visits, that time also you can tell her that go for the normal deliveries. What is happening these days? These days the cesarean on demand is increasing. The patients are saying that my vagina should be safe, my vagina should not be laxed, there should not be any problem, the leaking and other things. So there our role comes. We should advise them, just go ahead with the normal delivery and we are there to take care of your pelvis and all the diaphragm and muscles, and we would be taking care of that. And this is very important one is here. So let's start my presentation. I'm starting my presentation with few facts and nothing more. I would be telling about the HiFem chair, the high intensity electromagnetic chair, which is doing miracles, which is a wonderful thing. So let's pay attention. The mechanical aspects are related to widening of the levator hiatus and laxity of the pelvic floor, with descent relative to the pubococcygeal line, as I discussed. The laxity of the pelvic floor is related to collagen abnormalities that are either inherited or acquired related to pregnancy and aging. And let me tell you, the whole of us, everything from head to toe, is made of collagen only. So the aging, the wrinkles and everything appears because of the aging of the collagen. The type of collagen changes from type 1 to type 4. So type 1 in neonates, type 4 the old person. In between we have to remain. So from type 2 to type 3 we have to just check for the beauty of our face, for the body, and inside our pelvis, everything actually ages. The aging is very obvious on face and body, but inside also the same thing is happening, and that is why there are leakages, there are the prolapses. So this is something I wanted to show. Is it visible? Yes. So this kind of things, the way these, the whole slide is actually now 90-degree rotated. You can just imagine that bladder, uterus and the rectum, both are, they all are supported, and there is a hammock-like action of the diaphragm and all the pelvic muscles, the deep pelvic muscles as well as the superficial ones. They all just contract and they just help in preventing these organs to go downwards. And this is what, the same function we have to retain. So the American Society of Plastic Surgeons reported a 30% increase in the rate of vaginal rejuvenation. So this is the era now females have started thinking for their pelvic parts also, for their genital rejuvenation also, and this is something which should be welcomed. An Indian study too shows growing trends in the demand of aesthetic vaginal procedures, 3.9% from 2012 to 28.97% in 2015, and now we are in 2025. Data is not available, but this must be going to the 50%, I think. And Indian fast facts are 20 to 30% of marriages in India are breaking due to lack of satisfaction in sexual life. Yes, I have met a few females also, because I run a sexual clinic also, sexual health clinic. We cosmetic gynecologists, if you are entering into this field, you directly are entering into the field of sexual health. So you are going to take care of a sexual life also with the rejuvenation of the sexual parts, the private parts. So the females are coming that yes, I was not happy with my partner, and the males are saying that my partner was very cold. So that kind of things are also happening. They are becoming more, verbal. They are asking for the sexual satisfaction also, and my next lecture would be on orgasm also, the very bold one. So the 72% of women are dissatisfied during sex, but only 4% spoke to their doctors about it. Yes, this is the fact. This 4% we are welcoming. 21.87% of women in OPD are present with incontinence, and 39.6% of women above 40 years suffer from incontinence. Over 120% increase in Google search for vaginal procedures. Pelvic organ prolapse is seen in 41% of Indian population. So this is the data. And females have been suffering since long, but they were not so vocal. And the reality we can't ignore is overall 30% of women develop SUIs, stress urinary incontinence, within 5 years of first vaginal delivery. So this is so horrifying. One more video I found, because this was very beautiful. The Australian Association of Incontinence had made this, and this is completely telling everything about the pelvic floor and how it works. I think It is not audible. No problem. So this is our pelvis, where the muscles are there, pubic bone is, everything is written, and this is the way these muscles are holding, the whole diaphragm is holding our abdominal organs and preventing their prolapse downwards. And is it going? And this is the, once you invert it, you can see from outside that these are the hiatuses which are actually giving way while coughing, sneezing, lifting and laughing, as well as exercising, if the muscles are not working properly, because once these muscles contract, they actually prevent, they just close these hiatuses and they prevent the leakages from these three hiatuses. And this is the contraction which is needed for the prevention of the leakage. And this kind of contraction we attain from Kegel exercises. But I would ask you all, have you tried that Kegel exercise? It is so difficult without involving your abdominal muscles and thighs to do that. The proper Kegel muscle actually involves the contraction of the pelvic muscles only. And once you try, because you are late, your patient is late, she comes in her later phase of severity of incontinence, and there you tell to contract these muscles, and she takes the advantage of her abdominal muscles and thighs. The pure contraction of pelvic muscles is so difficult for some females, and there you need some kind of technology which is going to stimulate these muscles, and these muscles should contract automatically, and there should be number of contractions which is going to help that female. So what we do with this HiFem chair, and there I think there would be demonstration of this. Eager people are having a very beautiful chair. There, this is powered by HiFem technology, as I told, high intensity focused electromagnetic technology, which works on the principle of patented. This technology is patented. This is an extremely powerful electromagnetic field. Its high intensity enables to reach supramaximal muscle contraction while the patient comfortably sits on this Alfonso chair. So we are here to say no to incontinence. US FDA cleared for fully non-invasive electromagnetic stimulation of pelvic floor muscles. The chair helps rehabilitate weak pelvic muscles and restore neuromuscular control, offering an effective treatment for urinary incontinence in women. So what is their outstanding results are there, backed by science. Scientific research has shown that 95% of treated patients reported significant improvement in their quality of life. And this is very helpful for males also. So males who are suffering from erectile dysfunction or premature ejaculation sort of problems, they can also sit over there and their pelvic muscles can be strengthened by this chair. So benefits for the patient are, they remain fully clothed, this is non-invasive, and this is walk-in, walk-out procedure. So patient comes, sits and goes. 27% annual growth in female intimate health procedure. This was also here, discussed earlier. Incontinence is one of the most concerning female intimate health issues. Over 19 million women in the US are affected by incontinence. 5 out of 10 women do not seek help. They remain like, they feel shame going to the doctor and telling it, and they take it like we have to suffer. We are aging, and after 2 or 3 childbirths, this happens with every female. And let me tell you, most of my doctor friends, gynecologists are coming to me, and they are actually accepting that yes, they have been suffering from some sort of urinary incontinence since long. So this is something we have to come up, we have to speak up about this. So there is rising demand in incontinence care, and we have to meet our patients which are having urinary incontinence, which is involuntary leakage of urine, which is commonly caused, as we discussed here, aging, vaginal delivery, menopause, and other factors. And what happens? The collagen, the quality of collagen deteriorates, and that is why the muscles become weaker and they are not able to control the the processes which are actually there. So postpartum and postmenopausal women represent the largest patient population affected by urinary incontinence. So let's understand incontinence, because there is another lecture on incontinence, so I won't go much in detail into this. So there is two types are there, stress urinary incontinence and urge. And in India, we most of the times get mixed urinary incontinence. And consequences are loss of confidence, and there is loss of intimacy also. So this is so devastating. This is actually hampering everything in their day-to-day life. And there are results, there are multiple things, urinary leakages during coughing, sneezing, urine leakage during strong and sudden need to urinate is there. Patients are going to the loo and before reaching there, they urinate. And this is actually deteriorating their quality of life also. So the science is there that the pelvic floor muscles are responsible for control of continence, body aging, childbirth and menopause effects, and effective treatment of continence requires pelvic floor muscles re-education. So patients should be told about Kegel exercises, how to take care of skilled vaginal deliveries should be there, and they should be actually promoted for vaginal deliveries every time I say, because I have read that the vaginal, non-vaginal deliveries, the cesarean deliveries are actually precipitating GSM, genitourinary syndrome of menopause. So I always tell the patients, if you are not using it, you are going to lose it. Your vagina should have regular exercises, regular sexual intercourses, regular active sexual life, as well as the vaginal deliveries. For these all actually are helping for the exercises of these pelvic muscles. So hyphen chair is there, which has got a this is the video given by these Heger people, and this is a very good way to actually stimulate the vaginal muscles. 11,000 Kegel muscles are actually provided by these electromagnetic stimulations. So this is the way the whole pelvic floor actually contracts and relaxes and gives better control to the female for everything. So you can see before and after pictures, and there are proven pictures by ultrasound as well as by MRI pictures that the hiatus, the levator ani hiatus is reduced and the hammock actually goes up. So say no to incontinence, and clinical evidences are there that two complete clinical studies are there, 3 pending clinical studies are there, 120 patients evaluated, and it covers all types of urinary incontinence, and outcome is 95% patient satisfaction, significant improvement in patient's quality of life, results confirmed by 6-month follow-up. So this technology is actually helping a lot to the females who are suffering, and let me tell you that you have to nip the bud. As soon as the patient is coming to you with frequency of urination and other problems, there you have to tell that patient that you are not only suffering from the infection, you have to treat the UTI as well as the pelvic floor rehabilitation techniques should also be evaluated to the patients. Thank you so much.
Thank you so much, madam, for that excellent lecture. It's very, very useful and very simple, this thing, and it will make a difference in the patient's life, you know. Yeah. Madam, some contraindications for this? Any contraindication?
Ma'am, there should not be any metallic device inside
that's
the
very
body.
important.
Yeah, because this is electromagnetic, so pacemakers, if they are there. Even the intrauterine contraceptive devices are also in the debate. Sometimes we have found that they are displaced.
If any metal, any implant or metal is there, they should not. And one more is, if there is active infection, then also we are not supposed to do. And pregnancy though is a contraindication for everything. Or if they have undergone some surgery in the recent past, then also pelvic surgery, then you are not supposed to put them on the tube.
6 weeks is the funda, basic funda for us gynecologists. So after 6 weeks only, any procedure has been done, if has been done.
Yes, yes. Thank you, madam.
Thank you so much.
Dr.
Dear audience, I want your active participation. Kindly ask your question and answers to Poonam ma'am.
Madam,
Anybody
yes.
questions?
Yeah.
Mentioned about contraceptive device, but that age many will have LNG IUS for AUB. So is it a contraindication to use this?
Ma'am, that is not a contraindication itself, but we have seen in a few patients where Mirena was there and it was displaced. So it was working for AUB, but it was, if it is there for contraception also, it is not going to work. So we have to take care of that.
I think
Yeah.
we'll have to wait and see.
We have to wait, yeah.
Dr. Poonam, that was an excellent eye-opener. And as you rightly said, well, after listening to all of you in many numerous workshops around the country, I have started recently my aesthetic functional clinic in my setup.
Okay.
And here I would like to say that, as you said, I think we have to take an opportunity in the antenatal period
Exactly.
to talk about the rejuvenation of the pelvis, pelvic floor muscles postnatally. I think that is where we have to start with this. And we have to have an open, I mean, I have a questionnaire which I distribute to all the women in the OPD and the men, because they see the questionnaire and then they come inside with a filled up one.
Yes.
Otherwise, most of them, as you said, only about 4% of them will speak the unspoken. So I think that is where all of us gynecologists have to wake up to this aesthetic functional field, which is very, very essential for a good quality of life.
Exactly,
Thank you
ma'am.
for your wonderful lecture.
What I do, such videos which I have put over here, these videos are regularly running in my OPD sittings, like patients are waiting and there is audio visual, so no TV programs and other things, only these programs are there, and they are coming, their husbands are asking.
they will ask,
Yes, what is
exactly.
this and how can we avail this facility? Yeah,
Thank you.
thank you.
Any other doubts from the audience? No?
One more thing, what would be the cost of that chair? Approximate.
I think the company persons will tell you. They are coming in a range, and I would always advocate go for the better one, the patented one, better companies which are giving better services to you, because once you buy a machine and those persons who have sold are eloped, and now you are just fiddling with everything, so go for better machines from better people.
Okay, thank you, madam. Thank you so much.
Thank you, Poonam ma'am. Thank you. Yet again, brushing our physics and bringing the physics alive into our minds, and also updating us about the electromagnetic stimulation under chair. Thanks a lot, ma'am, for your wonderful speech. I now invite upon Mr. Sanjay Gautam, Director, Hegar's India and Boards India, to deliver his lecture on need of the cosmetic aesthetic gynec laser clinic, and most importantly, how to set it up. Over to you, Mr. Sanjay Gautam, sir. Just a minute. I extend my warm welcome to Sheila Mane, ma'am. I extend my warm welcome to Vidya Bhatt, ma'am. Thank you for being here, ma'am. Tumkuru is elated.
It's not coming in. Here Ma'am, can you give me the...
So Mr. Sanjay Gautam from Hagar is here to talk about the need of cosmetic, I would say an aesthetic gynecology clinic and how to set it up.
Good morning, gentlemen. Now I'm saying first time gentlemen first in gynecology conference. Gentlemen and few gentlemen and all ladies and ladies. This is just a small, like I can say thank you to the KSOGA. I have all the renowned face, all those trusted on our company like from like 19 years, Dr. Kasturi, Dr. Bharti, Dr. Vidya, everybody. So thank you very much, and it's again, we are in Tumkuru. Tumkuru means it's your home. So we started this company 2005, and first KSOGA we did in Hassan. So thank you very much KSOGA and all the delegates and all the authorities, seniors and everybody who trusted us. So it's all about what? There are huge machines are available. So I'm very much sure the people might be thinking it needs big space, and how to set up the aesthetic and cosmetic clinic, because it might be need most of the spaces, it might be needed most of the specialization. Definitely training is required, but how much and why and how to do it. So we are going to discuss about that. I will try to make it more. What, ma'am? I will show you everything, don't worry. What we will try to make it like, क्या हो रहा है यहाँ पे? So it's all about what? Ma'am, how many patients you are seeing like in your deliveries and everywhere? It's all about laser, what kind of options you are having when a patient is having SUI, what kind of other treatments you are having. So we are going to discuss later on about this, but yes, how to set up a clinic for laser, that we are going to discuss. It's a new era in women's health and beauty, need of cosmetic and aesthetic gynae laser clinic. Why it comes? Because you already have the patients. Sometimes when you're talking, you're having relationship from 18 years old ladies or women, whatever you say, goes up to 50, 60 years, the relationship. I'm talking about trust. So whenever they are coming, you are delivering the baby, you are doing everything for them. Then after sometimes postmenopausal women, you are sending to the urogynecologist or you are sending to the dermatologist. It's always better to have those patients at your clinic and you can serve on a better way. So nowadays, most of the people and most of the patients want and have more trust on you. So it's need of cosmetic and aesthetic gynae laser clinic. Every national and local workshop is packed, every hands-on training fully booked. Why? Because you already have the patients. The same patient is going to give you all the revenue, all the specialty and all the things all together. And why? Because India is transforming. With rising incomes and strong financial confidence, today's women from teenagers to seniors are more conscious about their body, beauty and intimate wellness than ever before. Nowadays, even if everybody, most of the doctors are going, most of the patient or most of the other patients are going for any kind of treatment, like any kind of beauty parlors, VLCC, looks before going to the marriage. So if they are coming to you, you can give all the kinds of solution to those people. It is the right time to invest in this booming segment and offer treatment your patients are already asking for. India needs more authentic state-of-art gynecology laser clinic where patients can trust, feel confident and enhance their fitness and appearance to match their spirit of modern India. The best part, nearly 90% of procedures can be performed by trained therapists, allowing, I'm talking about this, here in laser or these kinds of clinic, there is no need of any kind of expertise. You can hire the people, you can hire the therapist, you can hire the counselor, you can hire the other people so that they can support you. It's definitely needed because patient is having trust on you, but you can hire a support staff and they can do it, all these procedures. And who can, I'm having less time, so I'm going to show you some more videos. Opportunities across the woman life journey. Post-menopause, 50% seek aesthetic laser treatment, Kegel exercise, improve pelvic floor strength. Already Dr. Poonam enlightened on this. Post-delivery sacking of bulging stomach, cool stunning, restores pregnancy, waistlines. Ma'am, nowadays, even if you're doing normal deliveries, most of the patient wants, after delivery, they want vaginal tightening, vaginal rejuvenation. They want to reduce their belly. So they want each and every treatment. So nowadays, most of the laser clinics, what they are doing after delivery, 6 weeks after delivery, they are giving you one shot of laser shot for rejuvenation and tightening and one cool stunning or cryolipolysis also to reduce the sagging or bagging fat. And then body hair, beyond hygiene, laser hair removal is again a good thing to have in your aesthetic and cosmetic gynae clinic. Gives full body hair-free skin. Opportunities across a woman life journey. Face and beauty, facial contour address, basic beauty and confidence. Gynecologist advantage. Gynecologists start getting patient from 18 years and goes till later stage of life, providing lower in-house patient base, which is ideal to offer aesthetic solution. This is all vision. From vision to reality, setting up your gynae laser clinic. Vision and determination is definitely must. Clinical space, staff requirement, machine and technology, patient awareness and marketing. These all 5, 6, 7 things you need when you're going to start a cosmetic and aesthetic laser clinic or a setup. So we're going to talk about it. Vision is key. A clear and crisp vision drives success. Determination follow with the right vision. Determination comes naturally. Starts a new era. Your vision can transform your practice and set new standards. Finances are secondary. Definitely finances, everybody is going to look after on those things. But determination is really a very good need. Overcome challenges. See, this is a small setup, what we are doing when you are having a cosmetic and aesthetic center. See.
So this is Ashirvad Cosmetic and Aesthetic Center. I am showing you how much space is required, so we are opening a door.
This is a small setup you need
This is
to
the
have.
selfie point.
This is all 8 to 10 feet
How much space is required?
space for one machine. I'm going to show you the
This
machine
is
later on
the
as well.
chamber of the madam. This chamber is required, so this is the chamber, and this is the stand. And
This is a complete setup in
pipe
Varanasi. We are doing lots of complete setup here as well in Hubli and
This is the opening
Bangalore as well.
Inside.
In Karimnagar, in Andhra Pradesh, in Telangana, everywhere we are doing all this kind of
This is
setup.
sitting 1, 2, 3, 4, 5, 6.
So this much
people
space
sit.
is might be
These are
needed
the
if
posters.
you are having 5-6 machines.
Look at the space. This is first chamber, this is second chamber, and this is third chamber, and then this is the chair. Alpha and high intensity focused electromagnetic chair, and this is the complete. So you can see, once again I will show. So this is Ashirvad Cosmetic and Aesthetic Center, and showing how much space is required, so we are opening a door. This is the chamber of the madam. This chamber is required, so this is the chamber, and this is the stand, and then this white is the septicon, and then this is the opening we are doing inside, and you can see the space. This is sitting 1, 2, 3, 4, 5, 6 people can sit. These are the posters.
So this is required like every machine required only 8 to 10 feet space. So space will be required, it will be very less. You can hire one counselor, you can hire 2-3 therapists, and you can start these things. It's only all OPD procedure. There is no need to go for a big setup. There is no need to go for a big indoor setup. You can do everything. I'm talking about the young people, those who don't have the like indoor. If they are doing OPD, they can do the OPD procedure as well, like cryolipolysis, laser, everything they can do in OPD itself. I'm sorry, like the mic is not working on that way, so I'm going to skip it. So staff requirement is effective and efficient counselor guides patient and explain treatment clearly. That is, I'm talking about what you will be needed in the laser clinic. Front office staff professional and presentable, creating a positive first impression. Treatment assistant, 1 male and 1 female, or 2 female assistants for smooth clinic operations. Housekeeping ensures cleanliness and hygiene at all times. Because again I'm saying, when you are doing the patient you already have, no need to get the patient from outside. All your old patients are going to come and give you all this kind of, only the counselor you might be needed. So if you are able to counsel in a good way, then definitely you will get the results out there. And results we are going to talk later on as well. We have all machines, we'll discuss accordingly. So now this is machines and technology. Like I already said, it's 19 years. We people are coming with the new technologies every time. So now we are having Adolf laser for SUI, UI, vaginal tightening rejuvenation. So all these things can be done in OPD. So I'm talking about this machine. And we are having 2 models. This is the machine. We are having 2 models for this. One is Sabrina and one is Adolf. So here you can go for SUI, UI, tightening, rejuvenation, GSM, itching, infection, everything you can treat with that. And one more thing, these all are energy-based device. Means what? It's a controlled, I can say in a layman way, it's a controlled temperature machine. So there, whatever is needed and when it is needed. Like if you are going for the cutting and coagulation, it is going to work. At that time you need more temperature. But here, when you're going for SUI, UI and everything, that you need only 60 to 65 degree temperature. It is a controlled one. So new collagen is going to come. But when you're going to use in hysteroscopy, so that you can use this machine in laparoscopy, in hysteroscopy as well. So instead of Caesar, you can go and use laser for hysteroscopy as well. That we can explain you later on, but that can be used. Instead of Caesar, you can use the laser. So laser ज़्यादा से ज़्यादा खराब होती है हमेशा. So when you are doing the surgeries, it's going to break. So here, it's a different kind of thing. you can use in laser. Alphonse chair, already Dr. Poonam Mishra has already explained you very beautifully. It's a high intensity focused electromagnetic chair, and again, coffee break procedure, 10 minutes in OPD, no need to go anywhere. Kegel exercise. So this is also here. It's, you can use it. We are going to demonstrate here as well after later on. Ultra smooth for permanent laser hair removal means like most of the places, sometimes the customers, the females are going, before going to the marriage, they are going and doing all the vaccines and everything. So with this, they can go for permanent removal of hair. It is always good to have, and like the females are getting charged very high. But here, when you have all this in your center, everything is in the under control of a gynecologist or a proper doctor. So it is always makes a difference when you're using all these technologies. Cool sculpting for guaranteed inch loss by cryolipolysis. What happened, like they are having, it's a temperature control, again, 10 to -5 and vacuum. So it is going to create the bad fat, dead, and going to give you the inch losses. I'm not talking about the weight losses. I'm talking about the inches losses. Again, it's a very small machine having 4 probes here. So you can go with the thighs, you can go with the abdomen, you can go everything. And even this is all 4 probes are available here. And you can go with like what? Before going to the marriages, the females are going and doing this. And they are charging a lot for that. VLCC, look, and everywhere. But here you can put it in your center. No need to do it by yourself. Your staff is going to do it. And cool sculpting for guaranteed inch losses, like that ultra smooth and average face and body contouring. So whenever they want to like do something with the face, the machine is also available. These all are your assets, I can say. All are your where you can get the more revenue, where you can get the more treatment, where you can get the more patient, where you can treat them in a better way. These all machines are going to give you a right kind of approach and right, because now everything is changing. Previously, 20 years back, nobody is going for this. Now, every gynecologist are looking for this, because everywhere the cosmetic and aesthetic is going on a higher side. Now, treatment and procedures. Non-surgical aesthetic treatments, PRP, fillers, Botox, therapy, carboxy therapy, chemical peels, mummy makeover treatments, all are there that we can discuss later on. Now I have the less time, but still I'm going to finish it. Definitely you need a patient awareness and marketing. Educate and engage patients. Display videos of patient. I'm showing you the videos right now. I will try to show you in Kannada. See, this is चलेगा जल्दी लगा दो यार 2 minutes more मैम 2 minutes more fine क्लिक करूँ
अगर आपको खांसते हुए छींकते हुए पेशाब की बूंद निकल जाती है या फिर आपको लगता है कि बच्चा होने के बाद
These are all the FAQs where you can give into the Kannada. We have in all languages. So because the audio is not working properly, I am going to skip. This we are having in Telugu. This we are having in. This I want to show. Ma'am, this video I am going to show and then I am going to finish it. चलेगा ये? क्या हो रहा है?
I think we're running short of time.
Yeah, ma'am, I'm going to. ये जगह से ना. अच्छा कर दो, क्लिक कर दो, क्लिक कर दो. हटाओ से. छोड़ो. Ma'am, this is like I'm going to. This is how you are going to use a laser. It's very simple, no need to go for any kind of training. Definitely training will be needed. But yes, it's the OPD process when you're going inside and pulling back the laser. This is a 360 degree. And in our laser, we don't have any disposables kind of probe. We are having the reusable. So you can do it for 2 sittings in day 1 after 10 minutes of procedure. And this is how it is going to work. All the videos not, audio is not working, but yes, I'm trying to show you, and even we can show you later on as well on our stall. This is in Kannada. Nothing is working. Chalega? I'm going to learn lots of things. I'm from
Now it is possible to get rid of waxing and razor. For the first time in Karimnagar, get rid of unwanted hair by German laser. Unwanted hair from any part of the body can be...
So, because of less of time, I'm just going to show you, we are going to, like I told you, like we are always putting more of trainings every time. Now again, we are having more training on 8th and 9th of November with Dr. Sheila Mane in Bangalore.
Infrared RFI రేడియో ఫ్రీక్వెన్సీ మరియు వాక్యూమ్ టెక్నాలజీని ఉపయోగించడం జరుగుతుంది. ఇది పూర్తిగా
Thank you, Mr. Sanjay.
Yes, ma'am.
I think the videos will be playing in your stall, and all those who are interested can visit the stall.
Thank you very much,
for
and once again,
information.
thank you very much for the KSOGA team and everybody. Thank you, ma'am.
So we now have Dr. Poonam Mishra again, one of the pioneers in aesthetic gynecology in India, and she will be speaking about electromagnetic.
Thank you, Mr. Sanjay Gautam.
Okay, now Madam will be speaking on orgasmic shot, G-shot and G-shot enhancing.
Thank you, chairpersons, and thank you. The audience is actually the main treasure of ours. So thanks to you all once again. Okay. And a very important, bold and beautiful topic given to me. So I'm thankful to you all because I love this. And as I told, just a minute. Little. As I told, we, the cosmetic gynecologists, are actually dealing with the sexual health of a female directly. We are potentiating her private parts, the genitalia, the inner part as well as the external part, and we are actually making her more vitalized, potent sexually too. So here, the main thing is GSM, genitourinary syndrome of menopause, which is actually affecting every female who is aging. And what happens, her vaginal epithelium becomes very thin, her clitoris actually sucks in, sags down, and the sensitivity of these erogenous parts inside the vagina, the different points are there which are actually in debate these days also. They are the G-spot has been told that it is a fabled one, it doesn't exist. Some people say there are multiple spots, and I say that the whole vagina is erogenous. Every part of vagina is sensitive and has got sensuousness. So what we have to do, we have to actually rejuvenate the whole vagina as well as the clitoris and some skin glands also. They are two paraurethral glands which are actually very important for making a female wet. So these all have to be rejuvenated. And how do we rejuvenate it? Why do we rejuvenate it? It is for the pleasure and for the better quality of life. Every time there is the problem in a couple that whenever I ask my partner to come for the consummation and coziness, she says, there is headache, sar mein dard ho raha hai, aaj to nahi, kal to ye. So I always say that the pleasure content is fixed for the male partner, but it is not always fixed for the female partner. 90% or more than that, females are not having orgasm during the intercourse. They are bearing children also, they are having kids also, but few are there who have never attained orgasm. So this is something so, shyness is there, nobody talks about that, but this is the fact. And if a female every time, with every intercourse, she is also going to get the same pleasure as the male attains, no female in the world is going to say that she is having headache during that time. So this is what, and this is the message that we have to potentiate her vagina throughout with the orgasmic shots. These are the shots, means we are given the injectables in the form of PRP, the rejuvenating factor, or the fillers or something which is going to enhance those erogenous parts. So let's begin with the female orgasmic disorder, because she needs rejuvenation. Her orgasmic part is now diseased. And what is orgasm? Orgasm is a feeling of uncontainable pleasure accompanied by an act of ejaculation or a discharge of accumulated erotic tension. Orgasm has multiple potential health benefits due to the hormones and other chemicals that are released by the body during an orgasm. Orgasm do not only occur during sexual stimulation. Medical professionals have used physiological changes to the body as a basis for the definition, whereas psychologists and mental health professionals have used emotional and cognitive changes. A single overarching explanation of the orgasm doesn't currently exist. Everybody actually gives the definition in a different way, and there is a history. So in the the earlier times, we have got Khajuraho temple, the Sun temple, the erotic sculptures are there. And I got to know that when I was visiting Sun temple, there it was the lower parts are having the day-to-day rituals, how a lady is getting married, what are the functions and other things. And upwards, once you just raise your head, there the erotic pictures are there. And it was told that the whole society was becoming going towards the Buddhism. So the population was on the decline phase, and that is why the king thought that there should be a temple. Temple is some place where everybody goes, and there these erogenicity should be depicted, that everybody should know that marriage is an institution just to enhance the whole world is running because of the sexuality, the sexual contact, and our parents just gave birth. My mother gave birth to me, and that was out of that sexual intimacy, but we don't talk about that. The whole world is running, the whole, the generations are going on because of that, and that should always be related with the pleasure. Animals are not there to tell about their, experiences, but we, being the human beings, we can discuss and we can talk about that. So in 15th century, when the Islam invaded and all sexual pleasures and everything went behind the curtain, and that was the era where everything, the whole, the sculptures and everything, we have been so vocal about the sexuality of male and female, and then it went back again with 1800, 1940, the, evolution was there in the sexual health also. And now in 2000s, females and males are becoming vocal. So what are the types of orgasm? That could be clitoral, vaginal, anal, erogenous zones. They all could be stimulated, and a female can attain the orgasm. But the latest definition is different. All orgasms are the clitoral one only. And I was wondering that when I was doing my MBBS and in my anatomy class, the clitoris, the structure of clitoris was just a knob-like structure, equivalent to male penis was there. And later in 2009, it was discovered that these two crurae are also just behind the ischio-cavernosus muscle, and two bulbs which are in the outer part of the vagina, which are making the vagina, a bit constricted, and that is making it snuggling type of appearances there because of these two bulbs. They are also the part of clitoris, and they are erogenous. So the vaginal orgasm is also a type of clitoral orgasm. So all type of, if the clitoris of a female is healthy and rejuvenated, she is going to be attaining the pleasure all the time. So there are fake orgasms also. Many females are doing this, and there I found a statement on Google that I think of it as a relationship maintenance strategy. Think about that. A female is doing so much just to make the relationship going on. There is orgasmic disorder, is a lack or delay in sexual climax, even though sexual stimulation is sufficient and the woman is sexually aroused mentally and emotionally. And then she is not attaining the orgasm, there she needs the treatment. And this is the duty of the male partner, because most of the times the females are not going to the doctor and saying that I am not attaining the pleasure. So this is very much over there. Symptoms are that the female is now avoiding the partner, not going there, headache and everything because she is not happy. Many types are there: primary anorgasmia, secondary anorgasmia, situational, that many times the whole family is packed, everyone is there, every room, and they are not having the separate part, the private place. Now the anorgasmia is there and she is avoiding the husband, and general anorgasmia, many things are there. So there is always an orgasmic gap between a male and a female, not to achieve orgasm simultaneously. And why this happens? There is lack of foreplay also. Every time if there is some kind of treatment, the vagina should be given some injections, and now the problem is gone. This is not happening every time. Every couple, every female has to be evaluated. Proper history and everything should be taken care of, and there when the mental part and psychological aspects are not there and the female is suffering from the vaginal problems, then only you have to give these orgasmic shots, which I am going to discuss here. So physical and emotional and physiological problems are there. Other problems, interpersonal problems, past trauma, body issues, medication, especially antidepressants, physical conditions, miscommunication, lack of arousal, stress, tiredness, and preoccupation with something is there, and that is why the female is having orgasmic dysfunction. There could be older age, menopause, medical conditions, history of gynae surgery, cultural or religion beliefs. See, the old age sexuality, there is a big topic, the old age sexuality. What happens in our country and the families where rooms are not that much, the elder son gets married and the parents have to leave their bedrooms. Now they are shifted to the drawing room or somewhere. है ना? घर के बूढ़े और बुढ़िया लोगों को बाहर कर दिया जाता है. They don't have their personal space because अब तो घर के बच्चे are married, so they need a bedroom and other things. So many families are not having that much 2 BHK, 1 BHK sort of things are there. So that should also be taken care of. That age actually, there they need the coziness and proximity very much. कहते हैं ना कि जैसे जैसे age बढ़ती है, the old age, there you need the partner most with you, and what we are doing in our society. So boredom in sexual activity or a relationship, lack of knowledge about sexual function, negative feeling about sex, shyness of embarrassment about sharing the desire, poor self-esteem, and chronic illnesses are there which are causing orgasmic dysfunctions. So one has to take proper history, a complete menstrual and reproductive health history. Any inclination like LGBTQ, this is also becoming very evident these days. The partner is coming and saying that I got married because of my family pressure, but I'm interested in the males only. And the female says that I'm not interested in a male. So these things are also coming out. And interactive discussion, questionnaire, as you discussed, Bharti madam, questionnaire sessions should be there. There the patient becomes more vocal. So evaluation has to be done. Multiple indices are there available on Google, FSFI, Female Sexual Function Index and all. They are very helpful. You can just enumerate all those and you just give your patient, and he or she has to tick only, and you will get the data. So I would be coming quickly towards the treatment of female orgasmic disorder. That can be antidepressant, cognitive behavior therapy. This is all sexual health part. And then there is regenerative cosmetic gynecology. So this is the era of regenerative medicine, where we are treating the patients with PRP, platelet-rich plasma, stem cells, exosomes. These are all derived from the patient's own blood. They are autologous and they are again given to the patient just to enhance whatever the body is doing for the healing, just to accelerate that process. So we are giving fat-derived fat cells or fat graft, and the pre-filled syringes are available in the form of fillers in the market. Those who are interested are knowing about Botox and fillers must be knowing about these fillers. They are hyaluronic acid fillers, are available in the market. You can put somewhere and you can augment that structure. Now we are coming to the Grafenberg spot. This is the G spot, which is the most, controversial spot, and even many females are not knowing about their power, and many females are not accepting this, but yes, this was first described in 1950 by Grafenberg, and that is why it is known as Grafenberg spot. And this is situated in the interior vaginal wall, just 2.5 to 3 centimeters away from the introitus. There is a spot which is very erogenous, and once it is stimulated, a female gets the orgasmic pleasure. To be or not to be has always been, there is controversies. Even the papers have been presented just to confirm that yes, G-spot is there, and multiple papers are there, and if somebody wants to know about the G-spot, you will know when you will finally find it. And even in post-mortem studies, it has been found that in the interior vaginal wall, at that spot where we claim that G-spot exists, there is a cavernous structure, just like the male's penis, which is full of blood while arousal. The same way cavernous structure is there, so G-spot exists. And today in my topic, I'm going to tell you all about the augmentation of that G-spot, which actually becomes less sensuous once the aging is there or there is some trauma because of the vaginal birth. So let's start with PRP. On PRP, there is a different lecture, so I'm not going into detail. But yes, PRP improves vulval appearance, improves sexual life, tightens loose vagina. There is a question mark, but it does, and improves incontinence also. So we are directly injecting PRP into the bladder, and we are getting very good results for the urge incontinence. So I have got those techniques, and if you want to join me in my courses. I am a president of Indian School of Aesthetic Gynecology, which runs multiple courses every month or sometimes 2 months apart. So PRP is there, the platelet-rich plasma. We are preparing it in a way, we are obtaining the blood and then centrifuging, and the upper part is having platelet-poor and platelet-rich plasma. That platelet-rich plasma is now taken and is injected into the clitoris, that is O-shot, and into the paraurethral glands, and in G-shot. So G-shot is putting PRP injection at the G-spot. Yani, that means improving the sensual feelings of a female by putting injection. Charles Runnell is the person who invented in 2011. I'll take just 2 or 3 minutes more, just 2 or 3 minutes. So this is known as O-shot, and it is a patented one, so you can't just write at your clinic that we give O-shot sort of thing. So I have given the name the orgasmic shot. Keep it simple, but not like O-shot. So O-shot, you are preparing PRP and you are putting, I'm just showing a video, so it would be clear.
Clean all the stuff out, and then we go
This is a very good video, that is why I put it.
Like this,
even my videos are also there,
now
so the person is numbing.
Okay? Super cold, right?
Yeah. So you can numb by putting the injections, the lignocaine injection in those areas, and you can give some ice packs also. So here, the base of the clitoris is being given the lignocaine injection, and then again in the paraurethral glands. You all have observed the Skene's glands. Just on the sides of the urethra, there are 2 dimples. Sometimes it is not that easily visible. So in the paraurethral space, around the Skene's gland also you have to give.
You can see that it doesn't really swell because, again, the clitoris is just the outside.
Inside the vagina, at the G-spot. So the O shot, the orgasmic shot, comprises of injection of PRP into the clitoris, in the paraurethral glands, around the paraurethral glands, and in the G-spot. So all three combine to make, this is in the G-spot area, in the anterior vaginal wall, that is being numbed, and now the PRP is being taken. Now the PRP is there inside the syringe, and in the base of the two clitoris there is 0.5 ml PRP, if you are taking PRP. Few people take the whole plasma, which is platelet poor as well as platelet rich, and they inject. I also do that. I take the platelet rich plasma and 0.5 ml in the base of the clitoris, 0.5 ml paraurethral glands, and then the remaining in the G-spot, and whatever is remaining, the platelet poor plasma, because it is rich in growth factors and other things, I take and I rejuvenate the whole vagina, the two lateral walls, the two anterior and posterior walls, and I do the same. So it's clear, I think? Everything is clear? It's very easy. We are doing laparotomies and doing so big surgeries, laparoscopic and all that. We were talking about retroperitoneal surgeries Dr. Anupma is doing. So those things we are doing, and these are the trivial things which are there in cosmetic gynecology, and you can do that and you can just make your patients happy forever. So I think time is less. So just one word, fillers. Fillers are available in pre-filled syringes. We inject those fillers in fan-shaped techniques in G-spot area and in labia majora, just to give fat fillers. You can also get, the fat is harvested from the body, where fat is in excess. You prepare, fat is taken in the syringes, and you can inject where it is lacking. So just you have to take care that you are going into the cavernous part, so it should not go into the blood vessels. Fillers, once enter into the blood vessel, they create havoc. So you have to be away, learn how to use cannula for filler, filling of fillers at the areas needed. Just learn the technology and do it. Thank you so much.
Thank you very much, ma'am. That was a very nice, insightful talk. Thank you very much. Any doubts from the audience, ma'am, chairperson, ma'am?
Thank you, madam. It was an excellent lecture, very practical oriented. And the way you told, now everybody feels confident to do that. As you told, when they can do so much laparoscopic surgery, this simple, and they can make a difference in the patient's lives by your teaching, by your skill transfer. And one more thing I wanted to ask, do you combine this PRP with the laser or combined procedure?
Yes, ma'am.
Yes.
The combined therapies always work combined.
Yes.
So that is going to be an add-on.
Yeah.
Since my topic was not that, so.
That gives a better results and a long-lasting results.
Exactly.
Yes.
I
Thank you so much.
those- I
Thank
skipped
you.
those slides.
Okay.
Thank you, ma'am. Thank you so much.
Mike,
Yes, ma'am.
Now we would like to welcome Dr. Vidya Bhatt onto the stage, and all of you are familiar with the one and only Dr. Vidya Bhatt, who is from our own Nama Bengaluru, and she is the CEO, and her CV is not there, but I will tell you what I know of her.
I think ma'am wanted to ask something.
Yes,
Madam.
there's a question.
Hello, good morning to all of you. I am Dr. Nagalakshmi Bhattacharya from Mysore. I also study a lot about the sexuality and things like that. To start with, I will start with the immediate marriage life. Most of these girls, they come to me pressurized by the husband and the in-laws after 3, 4, 5, 6 months of marriage for not able to conceive. And when we do talk about the sexual life, I do ask about the sexual frequency, but that's important for infertility management. And most of the time are having regular sex, but I never ask whether she gets orgasm or not. And the husband also never tells anything about it. He's only interested to say that we are having regular sex, but she's not conceiving. So immediately after 5, 6 months after marriage, if they come to me, I tell them this is the time to romance. I tell them go to park, go hold hands, go to a picture hall, hold hands, have romance, and this is the time you will develop to try to know each other. I just wanted to make them feel that both of them should enjoy sex together. That's number one. Number two, after I do a lot of pre-menopausal and post-menopausal counseling, and I'm very eager to tell you that most of these women, when they come to me, I regularly ask about the sexual life. And many, believe me, around the age of 40, 45, many women are very highly interested in sex. That's maybe because they have more androgens in them. But unfortunately, when I ask about the sexual life, they tell me that most of their husbands are not interested in sex. And many of these husbands have medical problems, enlarged prostate, things like that, yes, and lots of erectile dysfunction. So I do call both of them and talk to them. Most of this talk that I've heard, there is no mention about the male partner. I am sorry to say that whenever these women have sexual dysfunction, husband must be counseled. And sometimes I feel embarrassed to do counseling for the man. So I send to a sex counselor. We have some in Mysore, and they speak to them, and then they are prescribed some medicines or whatever. Exactly. It is very, very important. It is very easy to blame the woman for every, in fact, most of the time the men blame the women, saying that I do not get a erection because she's not found to be, yes,
she's not active.
Yes. Most of the time they never accept that there is a problem in them. But I do not trust them. I always send them to the sexual counselor. That is very, very important. And then I sometimes wonder, is all these cosmetic surgeries we are doing on the women, not concentrating on their male partners at all?
We are talking because
No, I have not completed. The most of these things are seen in white women, mostly Americans and Europeans. Because these women, they keep getting married, second term, third term, fourth term, and then for them, they want that part to be lifted up or surgical, or cosmetic surgery to be done and all, because they are having another male partner. I think, is it?
While talking about the chair, I told you that the males can also sit on that. So because we are not given, we have got limited time too, but the fact is that we are giving P shots also. With PRP, we are giving penile shots. And we are making males potent also. But that is entirely a different topic that will need some time, and that is why, but correctly mentioned by you, that is actually half of the problems are because of male partners.
I just want to emphasize that the males must be counseled. It is not only the women that should be taken out.
We'll keep further discussions to our lunch session. We are short of time. Now I request Dr. Vidya Bhatt Madam to deliver a talk on urogenital problems in women above 40 years of age.
Yeah, Dr. Vidya Bhatt, all of us know, but the new kid on her resume is robotic surgeries, and she runs the NGO Radha Krishna Foundation, where infertility services are provided for the economically compromised. I want this to be highlighted, that's why.
Thank you, madam. Thank you so much, respected chairpersons. It's a joy to be here in Tumkuru. I would like to share one experience of mine here. I started my academic journey in Tumkuru. If you people want to reach where I am today, where I am in AGL, it is from Tumkuru. So Tumkuru is very auspicious for me. The same lecture hall, 2006, I started my academic journey before any society recognized me. So I sincerely thank Tumkuru for giving me this opportunity. And today on a different topic, cosmetic gynecology, there was so much discussion, heated discussion rather. But let's look at the women above 40 years, and these are your target cosmetic gynae patients. You start at a cosmetic gynae clinic, no woman will come to you for labial lift, no woman will come to you, even for a sexual dysfunction, they may not come to you, but they will definitely come to you for these urinary problems. They are your own patients, you have to just ask them. So any woman who comes to you above 40, please ask her any urinary problems, any sexual problems. You will get a big history, very big history there, and they are your patients for cosmetic gynae, and that's how you start your cosmetic gynae clinic. Because I have started my cosmetic gynae clinic 1 year back after I went for a training, and this is what I do in my cosmetic gynae clinic. I haven't done a labial lift, I haven't done a filler,
but I do these procedures. So, introduction, urogenital problems, every woman will have after 40 years. This is perimenopause, menopause, postmenopause, and formerly vaginal atrophy in these patients, it was thought of because of low estrogen. There is vaginal dryness, there is irritation, there is burning, painful intercourse. Only when you ask them, they'll tell you, otherwise they will not come out with this problem. And urinary symptoms, urgency, and recurrent UTI. Don't neglect those women who come to you with recurrent UTI. Take some time to examine the vagina, take some time to ask the history, get a urinary culture done. We neglect the men, yes, get their semen and urine culture also. So that is very important for us to treat the women with UTI. Then the common urogenital problems I told you, decreased libido, then dryness, discharge, white discharge, all these problems they come up with. The incidence, when you look at the incidence, 19% in premenopausal, perimenopausal 31%, and menopausal 55% of them. They all get lost in the physician's clinic where they go for their BP checkup, they go for their diabetes. They don't come to you, they literally get lost. So please try to identify them, tell your physician to send them to you, basically because they need your attention. So sexual problems they'll have, bladder problems, sexual is 56, bladder is 42, and then 39% of them will have dryness. So all this is because of reduced estrogen, obesity, menopause, and of course trauma during childbirth. So what is the etiology of SUI? Chronic cough could be there, there could be prolapse, or you just examine the vagina, everything will look normal with minimal cystocele, they will have these problems. Now what is the pathophysiology here? Pelvic floor dysfunction is there, hypermobility of the urethra, and then sphincter deficiency. You have to differentiate between the two. It is not for the urologist, it is not for the urogynecologist, but it is for the gynecologist itself. We have to know the differences between the three. So the types of incontinence, you should understand stress when there is intrinsic factor deficiency, urge when there is hypermobility of the urethra, overflow incontinence, yes, sometimes UTI also, neurogenic, which is very rare, there could be associated morbidities, so that is a little rare. And how do you grade? Grade 0, there is incontinence, but there is no leakage. They just complain of irritation, some kind of problem I have, that urine irritation is there, they'll tell you. Second one is grade 1, coughing, sneezing, and jogging. They are all fitness freaks, but they have this problem and they have to move from pads to diapers. Let it not be that for them. It is pads and end of it, let's take care. Nareshwari just told me about it. And then grade 3 is with mild stress, that is when standing position they'll have. And grade 3 and above, you have to put a TOT tape, you have to do a burst, so you can't treat them. But look at the patients who are in this group, from that grade 0 to grade 3, whom you could not treat all these days. You sent them to a urologist, you didn't have an answer for that. Now there is an answer for that, and let me tell you what it is. So medical management, of course, you have the different medications, anticholinergics, which I'll tell you. Then grade 1 to 3, PRP, chair, the electromagnetic chair, and threading. So these are something very important, and of course laser. So you do all this, the patient will have, don't give very promising results to your patient saying you will be 100% all right. No. They will be 70 to 80% they'll be relieved, and they will thank you for that. So what are the other abnormalities which we saw? Connective tissue disorders, hypoestrogenism, vascular insufficiency, intra-abdominal pressures, then your cystocele, rectocele, and all that. But what do we do all these days? We send them to urethroscopy, urometry, cystography, cystometry, all sorts of things. And then there was this conservative management which patients also got very scared of. Some neuroelectric stimulation, pessaries, vaginal cones, then lifestyle, of course, lifestyle management should be there. Pharmacological interventions, miragrain we could give, but that was in a limited patients. But now the other, and even urethral bulking agents, when they were not fit for the tape, that is when there was intrinsic factor defect. But now what do you have? When you tell them do Kegels exercises, nobody does. But you have this chair. We make them sit on the chair for 20 to 28 minutes, and then there is a lot of pelvic floor muscle stimulation, and there is a lot of relief for them. Then of course this MSLR chair, the treatment protocol is 6 settings are recommended at a frequency of 2 to 3 sessions per week. Each setting is 28-minute session, and during this, when they sit on this high-fem chair, you will find them there is a lot of relief. Whatever chair you take doesn't matter. You can invest anywhere between 20 to 2 crores, no problem. But definitely you will make some amount of extra earning for yourself. And of course, so many patients are relieved. Tropical estrogen you can give. This is what we have been giving. Whatever they came, yes, estrogen cream. But they came and said, no, nothing is happening. Then of course, all these drugs we gave them, and the duloxetine, all this we gave them. But that gave a little relief, and that's it. Injection of bulking agents, yes, done through a proper urologist, it really helped for intrinsic factor defect. But what about the hypermobility? Nothing happened to these patients who had hypermobility of the urethra. So these are the newer modalities which benefits and which gives them relief, that is vaginal laser therapy, vaginal PRP, and vaginal threading. So for SUI, you start with the combination of chair, make them sit on the chair, then you do laser, and then PRP. These 3 combinations is really going to work. This is my cosmetic gynae clinic. I have this laser, any laser you can buy. Of course, you can buy from Hagar's only. And you insert that, there is up to 250 joules you have to go, depending upon what laser machine you have. I have the CO2 laser, so I do it up to 250 joules and almost up to 3 to 4 minutes. You take it in and take it out, and then what happens is it goes all around 360 degrees, and it will cause fibrosis, and then it will rejuvenate the collagen in the vagina. Then of course the normal and the stress incontinence, you know, here also PRP is a beautiful technique. It's also called as the liquid gold for anything. Non-healing ulcers you give for episiotomy wounds, you give for cesarean section, non-healing gape wounds, everything PRP does wonders. So we have been giving PRP for wide discharge, for vaginal rejuvenation, of course G-spot, which Dr. Poonam so beautifully explained, and then the setting is every 3 weeks. And of course, local anesthetic you have to put, lignocaine spray I put. And this is how the PRP is done. My embryologist, I have one dedicated embryologist now doing only PRPs. The other embryologist will do all the IVF work, but one embryologist will do only PRP now. Basically, you put a small speculum, spray the lignocaine gel, and go all round. Each injection should be around 1 to 2 centimeters apart. That will rejuvenate the whole vagina, and even with the second treatment they come and tell you, ma'am, I'm feeling much better, really relieved. So you are really relieving them of these problems, and take insulin syringes. It doesn't cost you much. The centrifuge will be there. Train somebody, get those PRP kits, and charge nominal. Don't be very expensive initially, basically because you want to promote this and you want them to accept it. Then of course the vaginal threading. This is a very beautiful technique which these threads are available, and this was used for the facelifts. Facelifts by film stars, Rekha, Hema Malini, all must have used. Basically they lift the face, these dermatologists. What we do here is we lift the vagina. So this threads you get, very thin needles, it is aligned with it, and you have to, you can use it for vaginal tightening also. Vaginal tightening, one setting you use from 3 finger, it will become 2 finger. So if you do this, there is a lot of relief to the patient who comes with laxity of the vagina. And then this is how you do for the urethra. Basically, you go through the below the urethra, and initially after the TOT tape there was one more which came, I don't know whether people are using it, which was a small mesh like thing which we had to open the 1 centimeter below urethra, fix it, and then their stress incontinence came down. But it didn't last long, basically because of the cost. But here the cost is not much. Your 20 needles, you will get it for about 2,500–3,000. So you can charge the patient and then go below the urethra in a U-shaped pattern. So after one needling, you put another needle about 3 to 4 millimeters away, and then you don't require skill, no retroperitoneal dissection, nothing, no advanced lap surgeries, no lap suturing. All you have to do is just go in that subcutaneous plane and pull it out, and the thread will go in. So then there is a lift which happens, and this is very good. Patients are relieved with this. All you have to do is, you can see that bead there, so just push it inside and remove it. The bead will come to the apex of the needle. So once it comes to the apex of the needle, the thread has got inserted. So this, and surgical approaches, of course, yes, when they require surgical, suppose they don't respond to this, then do a Bursch Kalpa suspension. I'm always there, you can call me, one call away if you want a Bursch Kalpa suspension, but it's just a joke, but anybody can do a Bursch Kalpa suspension. Go to the plane of Retzius, remove the peritoneum, put down the peritoneum, and then identify the bladder neck and take 2 helical stitches. So if you take those 2 helical stitches on both the sides, this was one of my live demonstrations which I did. So all you have to do is, from the ligament, you take a helical stitch, and then that's also called as the Cooper's ligament, and you take a helical stitch and it is done. And then of course, I have still one more time. Of course, this is how it looks. And then the TOT and TVT procedures. TVT procedure is a little difficult basically because you have to go adjacent to the urethra and pull it up, which may not be very comfortable for people, but the transobturator tape is very good. But the problem is of the mesh induration, but people are using it for really indicated cases. Now, which are the cases do you think need a transobturator tape or Bursch? You make the patient pass urine and come to the examination table and ask her to cough. If there is a spurt of urine, then you know that this patient needs tape. No laser, no PRP, no threading is going to help. So such patients only put this TOT tape, and this is how the TOT tape is done. Put a catheter, take the tape. It's very simple. You have to identify the transobturator area and then bring that tape out in the, make an incision below the urethra. I'll just run this video. Yeah. So yeah, open it like this, and you have those applicators which for the right hand, right side, and left hand, left side. All you have to do is put that applicator, because this was a long video. I have just, see, this is the applicator. You take that applicator, and the right side and the left side should be seen, and then see to it that you don't fold the TOT tape and then put it, and then you will get wonderful results. Patient is relieved. So menopause is a time when a woman's body goes through significant changes, and it can be challenging, but it's also time for empowerment and self-discovery. Embrace it and don't be afraid to seek help whenever you need. Thank you very much for your kind attention. Just follow us on these for more details.
Thank you very much, ma'am. It was a very informative talk.
Thank you so much, madam. Very excellent, very practical oriented, and you inspired many minds to go and do now. Everybody will start practicing PRP and threading.
Easy, simple, feasible, and very friendly to your pocket.
Yes.
And you can earn out of it.
Yes.
Very, very
Yes.
practical talk. Thank you so much.
Great,
Yes.
Thank you very much, ma'am. Now I would like to call Dr. Shobha Shavi ma'am to deliver a talk on cryolipolysis. I request our chairpersons to introduce madam.
Yeah. Welcome, Dr. Shobha Shaivi. She is a young Turk of KSOGA, and she runs the Shavi Sanjeevani Hospital at Ilkal. And she has her areas of interest are fetal medicine, genetics, and recurrent pregnancy loss and critical care in obstetrics. She's been the secretary of Bagalkot OBGYN Society, secretary of Critical Care Committee KSOGA, and the chairperson of the Yeah, she's an active member of KSOGA, and she works in a rural place, but she has shown that you can do it if you dream it. So she is into laparoscopy and she is into aesthetic gynecology, and as Dr. Vidya Bhatt said, I think this has to be part of our clinical practice, and it is very much doable. I am in a very comfortable position now, where after my aesthetic gynecology clinic, I am trying to address a lot of issues which women in rural areas are not getting the care they need to. Thank you. Over to you, Shobha.
Thank you very much, madam, for that kind introduction. Ellargu namaskara. I bring greetings from Ilkal, Silk City of Karnataka. I see all my teachers, my stalwarts of KSOGA. It's very great to be here. I thank Tumkuru Society for giving me this chance, and it's my great honor to talk in front of my teacher, Dr. Kasturi Doni madam, who has been an inspiring figure for me, and also Dr. Bharti madam, who has been the pioneer of aesthetic gynecology in Karnataka and past president. She's also a great inspiration for me. Now, going on, you heard talks from stalwarts like Poonam madam, Anupama madam, Vidya Bhatt madam, who have shown you that cosmetic gynecology is the most interesting and exciting field right now in gynecology, and they made it look so simple, and everybody can do it. I am from a rural area, and even I am practicing this since 4 years, so you can, all of you can also try in this. So they talked about many things like vaginal rejuvenation and urinary problems. Now I am going to talk about one more very interesting and very common problem, that is obesity. Obesity is one of it's the greatest health concern worldwide. Sedentary lifestyle, stress, unhealthy eating habits, irregular sleep have caused an unprecedented increase in obesity. To say it's the greatest epidemic of our times. So it not only affects the physical health but also mental and emotional health. It cracks the confidence of young ladies and also affects their fertility and also causes lot of medical problems. So it's a very important cause of mortality and morbidity. So treating obesity has become $1 billion industry. There are many options like diet, exercise, drugs, non-surgical methods, device-based interventions, behavioral changes, and surgery. So before treating obesity, we should know what is the difference between subcutaneous fat and visceral fat. Subcutaneous fat is the fat which is just below the skin. It though makes the person look fat and not so beautiful, but it doesn't have too much of health implements, whereas the visceral fat, it cannot be seen, but it causes lot of health implications in a person. It is highly metabolically active and releases hormones and inflammatory substances. So it is also called as toxic fat. It can cause health issues like high blood pressure, heart disease, diabetes, and even some cancers. So weight circumference of more than 80 centimeters in females and more than 94 centimeters in male could have too much of visceral fat. So to prevent visceral fat, we have to focus on living a healthy, balanced diet and also healthy, physically active life. So what I am going to talk now, cryolipolysis doesn't work on visceral fat, but it mostly works on peripheral fat that we should know, subcutaneous fat. Cryolipolysis is one of the non-surgical option. This method uses controlled cooling to freeze and destroy fat cells, which body then eliminates by a process called as phagocytosis. One of the brand is Cool Sculpting, which you can see here. There are also other non-surgical options like laser lipolysis, radiofrequency, ultrasound fat cavitation, and also injectables. And the surgical option most known to you are liposuction.
So coming to cryolipolysis, on which I will be concentrating more, it's a non-surgical cosmetic procedure that uses controlled cooling to destroy targeted fat cells. Fat cells are more sensitive to cold compared to other cells of the body. So when we use cool sculpting, this cryolipolysis, other cells of the body are not affected, but the fat cells get crystallized, and the crystallized cells are then undergo apoptosis and they are evacuated by the body slowly. It's a slow process, not a fast process, which is the advantage. So the principal action is, as I told, they are more sensitive to cold. Adipocytes are more sensitive to cold, and controlled cooling leads to crystallization of lipids. And apoptosis and gradual clearance of dead cells occur via lymphatic drainage. So this is how it acts. The cooling, the probes are applied over the skin. The probes are applied over the area where we want to do cool stunning, and that area, tissue will be sucked into the probes, and that will cause crystallization, leading to so there will be activation of caspase pathway, which leads to adipocyte apoptosis. So there will be no damage to skin. So you can see the device there, it's there, cool stunning. So it contains 4 probes are there, different size probes are there, and there is a console where you can do the settings of temperature and pressure. And this is how we apply. You can see that the picture, this is how we apply. First we have to select an area where we want to reduce the fat bulge. There we apply the probe and keep it for 30 to 40 minutes. Pressure will be around 5 and temperature will be around -5 to -10 degree. Once we remove the probe, there will be some reddish discoloration of the skin, and we have to massage that area to make it more effective. So you can apply it over the back, over the arms, over the legs, and also the abdomen. So patient selection is very important, and area has to be marked. After marking the area, we have to apply a gel pad, like which contains a tissue which contains a gel, so that the skin doesn't undergo frostbite. After application, we have to wait for 30 to 45 minutes. So the temperature setting is -10 to 10 degree. Treatment duration is 30 to 45. Results will be visible in 3 to 8 weeks. Immediately there can be a change of 1 to 2 centimeters, but actual results take 3 to 8 weeks because the fat cells have to be removed by the body slowly. So the real results will be seen in 3 to 8 weeks, mostly maximum by 12 weeks. So how inch reduction occurs? Crystallized fat cells die and shrink in volume. Gradual reduction in localized fat layer occurs. So there will be an improved body contour and inch loss is observed. So what is the difference between weight loss and inch loss? When you do cryolipolysis, you don't say you're doing weight loss. You say you're doing inch loss, because fat cells, they don't weigh too much compared to other parts of the body. So even if you lose 1 centimeter of fat, there may not be too much of weight loss. But definitely there will be an inch loss. So your patients who doesn't fit into blouses will fit in, and to pants they will fit in, but there won't be too much of weight difference. So weight loss targets total body mass, inch loss targets local fat pockets. Cryolipolysis reduces fat cells permanently. Weight loss may not occur. Maintains skin tone and elasticity. This is the difference between liposuction and cryolipolysis. In liposuction, what happens? You remove fat immediately. So there will be a lot of skin will become sagging. But that won't happen in cryolipolysis because it happens over 3 to 4 months. So skin elasticity will be retained. There won't be any unsightly hanging abdomen in these patients. How inch reduction occurs? I told about that. So histopathological evidence. There have been microscopic studies to show how the adipocytes change over time after cryolipolysis. So you can see this is the before picture. You can see the size of the adipocytes here. Here you can see the adipocytes shrinking, whereas the collagen layer is intact. It is not affected. So there is no change in skin texture.
And even sonography has been done to see how much of fat loss has occurred. Average fat layer reduction of 3 to 4 mm after 4 to 6 weeks has been seen. So this is after 6 weeks. The first one I showed was immediate. This is after 6 weeks. You can see significant change in fat layer here. So this is the before and after picture. You can see the waist has reduced beautifully. So timeline for results, 3 to 6 weeks, initial changes may become noticeable as body begins to eliminate frozen fat cells. In 2 to 3 months, most patients see the most dramatic results during this period as the body has processed a significant amount of damaged fat cells. Up to 6 months, the fat flushing process can continue for several months after the initial treatment. So the full results may not be realized until around 6 months. So I would like to give some practical examples who have undergone this treatment and what were the changes observed in them. Patient Mrs. XYZ suffering from morbid obesity. Usually cryolipolysis we don't advise to patients with BMI more than 30, but I have tried in those patients also and it is definitely helped them. Patient XYZ suffering from morbid obesity with the diabetes and hypertension underwent 2 sessions of cryolipolysis. Probes were applied both on back and thighs and abdomen. The measurement around umbilicus to begin with was 126. After treatment it was 122. After 2 months it became 120. And thigh measurement decreased from 60 centimeters to 54 centimeters. And it also helped her control her diabetes also. And one more patient, Mrs. ABC, suffering from morbid obesity, took treatment for abdomen, back and arms. She had very big arms, so she opted for treatment for arms also. Her waist measurement changed from 57 to 54 immediately and 50 inches 6 months later. And her arm measurement also came down by 5 centimeters. And she had to stitch new set of blouses. Patient Miss IJK took 5 sessions of treatment for abdomen and back. Waist measurement changed from 46 to 43 centimeters immediately and 36 inches 6 months later. And whenever we do this, it is very important to tell that healthy diet and exercises are very, very important. It is not a substitute for healthy lifestyle. They have to follow up with good diet and healthy lifestyle. And her weight also dropped from 82 to 76 kgs. So comparison with other types of cryolipolysis, cool stunning offers faster and even cooling cycles, prevents frostbite through active temperature control, because this is very, very important. If there is no proper temperature control, they can end up with frost bites. And treats multiple areas simultaneously. Because we have 4 probes of different sizes, we can treat multiple areas simultaneously. That is one more advantage. So the patient has to take less sessions. So comparison with liposuction, what is the advantage over liposuction? Liposuction is surgical, needs anesthesia and downtime of 1 to 2 weeks. Cool stunning is non-invasive, no downtime, results are natural and progressive. Comparison with other techniques versus ultrasound, there are no danger of thermal burns. Compared to radio frequency, it has deeper penetration and no surface heating. Compared to laser lipolysis, it is painless and uniform results. This technique involves no anesthesia. After the procedure, patient can go home. There are very few contraindications also, which I will be telling next. So comparison with cool stunning, liposuction, radio frequency, ultrasound cavitation and laser lipolysis. So compared to all this is non-invasive. There is no need for anesthesia. There is no downtime. Pain and discomfort are very, very minimal. And result is immediate and also it is maintained over a time of 3 to 6 months. Safety is excellent. I have not seen any side effects till now. And there is not much maintenance and there is no much training involved. We can train one of our staff and they can do all the work. So precautions and contraindications, we should avoid doing this in patients who have severe cold sensitivity or cryoglobulinemia. Alcohol should not be taken 24 hours before session and she shouldn't be She should not have been taken food 1 to 2 hours before the procedure, and even after the procedure 1 to 2 hours she should not take anything. And we usually avoid it during menstrual periods, and proper hydration before and after procedure is very, very important. Post-treatment care, no heat or massage for 24 hours, stay hydrated, and mild activity is encouraged. So what is the treatment duration and scheduling? 1 session per area every 30 days, 2 to 3 sessions for optimal results, full effect in 8 to 12. So what is the patient experience? Usually it's a comfortable procedure. When we apply the probe, there will be light suction effect. So when for very sensitive patient, we keep the pressure little low. Patient report mild numbness involving in hours, high satisfaction due to visible contour changes. It is affordable non-surgical method. There is low maintenance and consumable cost. Not suitable obesity. For obesity or large fat volume removal requires patience. Results are gradual, dependent on operator skill and patient experience. Future, there are very exciting prospects, like there is integration of AI feedback system, and newer cryo applicators make the procedure even more effective, and combination with radio frequency and ultrasound can enhance the outcomes, and it is very important to tell them about lifestyle changes also. That's it. I think I've done most of the things, and I'm open for questions if you have any.
Thank you, Shobha. It was very nice lecture, and you really enlightened us with this method. I think it is very practical, and many people can use it, and it's very non-invasive. It can be used by many people. But I think the cost is the main hindrance here. Cost of the machine is the main.
But madam, for patients who have tried diet and lifestyle changes, exercise, they've done everything, but they've not lost weight, then it is really a boon for them. And once we start using, and when more patients come ahead, the cost will come down.
And any complications you have seen with this?
No,
any
madam.
complication?
Not madam, no complications.
Any nerve damage, the underlying nerves because of the frostbite or anything?
No, madam.
No.
Like if you apply the membrane gel pad properly, there won't be any frostbite, madam. If there is the membrane slips and the probe comes over the skin, then there can be frostbites.
Yeah.
If that membrane is there, there is no chance of frostbite. When patient complains of something, we reduce the pressure, madam. If we reduce the pressure, there won't be any other problem.
Very rarely they can have nerve damage, very rare complication. And very rarely some people can have the increase in size of fats. It's a very, very rare complication.
It's a very rare
complication. Instead of decrease, it can have an increase in the size.
In
That's a rare
1%
complication.
death.
You need not be afraid. It's very rare complication of that.
Actually, it can be done in for double chin and all also. But I don't do it because I'm afraid of that complication.
And in future, if AI comes into picture into this, AI can monitor the temperature in the where the nerves are there, and it can stop there, or it can increase the temperature. So the complications can be reduced if we have AI associated with, and in future, it's not going to be far off, and everything AI is coming, so that can reduce our complications and more safety profile. Yeah, thank you, Shobha. I'm very happy that Shobha, our own student, is giving lecture, and so innovative. And she's not only this, anything recent she adopts, and she's ready to spread that knowledge. Thank you, Shobha.
Thank you very much, madam.
Thank you, ma'am. Thank you for your input. It was a very nice, informative and interactive session. Now I would like to call up Dr. Anupama Sethi, madam, to deliver a talk on carboxytherapy.
Dr. Anupama has already
Over to
been
you, madam.
introduced, and she has already spoke to us before. Over to you, Dr. Anupama.
Is next, Kadisha? Yeah. So now I'm going to talk about the topic which normally we all get into it, that is carboxytherapy in cosmetic gynecology. See, for me, once I went to American Aesthetic Conference, I actually wanted to look for something which only plastic surgeons can do. You look for scars. I myself had scars, but none of the plastic surgeon can reboot those scars. Then there was something like, I still have a lot of pigmentation here. I've tried with a plastic surgeon years back. Now also I'm finding it like, you know, in young age you want that. And these are the things actually, the stretch marks, the CS scar marks. Sometimes, you know, even the vaginal episiotomy scars are there. They are very, very well painful for the patient. And in those cases, this therapy, that is the carboxy therapy, comes into picture. I just asked Dr. Poonam, she only told me that my carboxy therapy machine is made, is a Skymedic production. I didn't know that. We both bought it from somewhere. So telling you about now exactly how the carboxy therapy works. Carboxy therapy is not a new technique with medical practice, and it's been used, we are using CO2 otherwise day in and day out. In 1955, carboxy therapy increased in popularity in the field of aesthetics, and particularly in the field of lipolysis and dermal regeneration treatment. So carboxy therapy is the therapeutic administration of small amount of medical grade CO2 in the subcutaneous tissue with the help of a needle. We I'll show you the videos. You can just inject those. Then the characteristic of CO2, final product of the organic metabolism. Therefore, it is obviously it is not causing any allergic reaction or toxic effect. It is blood soluble, that is non-embolic, colorless, odorless, soluble in water, heavier than the air, and it has got high diffusion in the tissues, close to 25x more than the oxygen. So the main effect is come with arterial vasodilatation. The direct action of CO2 on vascular myocytes, increase in blood flow, introducing vascular endothelial growth factors, increase microcirculation, and neoangiogenesis. This is the major way how do we use this carboxy therapy. Carboxy therapy in vulvovaginal regeneration is by the physiological effects of neocollagenesis, lipolysis, increase in the pH levels, stimulation of the subcutaneous baroreceptors, and Bohr's effect. So normally if you give CO2 to a patient, it stimulates the oxygen requirement hypothesis. Approximately 70% of the CO2 in the body reacts with water component to form the plasma, to form carbonic acid, and ultimately leaving bicarbonate dissolved in blood plasma. So what is Bohr effect? Bohr effect is that whenever you have excessive CO2, obviously the blood will be hunger for oxygen. This is what is the Bohr effect. This effect facilitates oxygen transport as hemoglobin binds to the oxygen in the lungs, but then it releases in the tissues, particularly the place where most oxygen is needed. So hemoglobin's oxygen binding affinity is inversely related to the acidity and concentration of the CO2. An increase in the blood CO2 concentration leads to decrease in blood pH that will reduce, causing hemoglobin proteins releasing their load of oxygen. Conversely, a decrease in CO2 increase in pH will result hemoglobin picking up the oxygen. This is the main line which has to be taken care of. So medical CO2, so that's what is the basic. And whenever there is oxygen pickup, there will be neoangiogenesis, there will be more effects coming through oxygen. So medical CO2, gas supplied by licensed companies have to be used. CO2 must be sterile, not containing more than 1% of oxygen, not containing more than 4% of nitrogen, not containing more than 95% of CO2, and it is chemically and biologically harmless. There are different ways of administration of the therapy, that is by the continuous or the bolus administration. We'll talk of this continuous administration as well as the bolus administration. Continuous CO2 administration with a gradual technique of administering predefined amount of CO2. Okay, this continuous is for face and neck. And bolus administration of CO2 means at specific places where we want the thing to occur. The routes of administration are intradermal or intracutaneous administration of CO2, subcutaneous, subdermal administration, as well as intramuscular or on fat deposits administration of CO2. And intradermal and intracutaneous are very superficial. You just have to insert the needle at 15 to 30 degrees. This is the way we inject the CO2 through small needles, small gauge needles, and once you have to do at intradermal means below the eyes you have to do, or for the stretch marks, then you have to insert at the, it is 15 to 30 degrees. For subdermal injections, it is approximately at the level of 45 degrees. And intramuscular or for fat deposits of administration is at 90 degrees. So before giving anybody carboxy therapy, you have to make the patient have 2 to 3 liters of water at least 3 days regularly, and after 3 days you do the carboxy therapy, and after post carboxy therapy also you have to tell them to take in there should be increased intake of water, there should be balanced diet, no smoking, no alcohol, refrain from over usage of drugs. Then the indications. Now we come to the indications. They are the episiotomy scars, post-cesarean scars, fissures, lubrication, decreased sensitivity, skin laxity or sagging, and muscular laxity. I feel cesarean scars and the episiotomy scars, patients do come to us. So how exactly we can tell them? Even, people who have keloid formation tendency, they come to me with the laparoscopic scars and they say that I have itching in this, this has become very thickened and all that, and then you have to tell them that no, it's a normal way, your skin is like that. But yes, there are people who are having keloid tendencies. In those patients, it is a very good therapy. Contraindications are artificial pacemakers, myocardial infarction less than 2 years. All these medical, you have unstable angina or thromboembolism, cardiac failure, coagulation disorders. All these factors are there. So, durability of the results obtained with carboxy therapy, result will depend upon the lifestyle of the patient, and within 5 to 6 months you have to repeat the therapy. I'll show you now this is a treatment on which there is a scar and we use this, okay? You use on the, like if you have very much, this is for fat prolapse, and you use heated gas, low flow 40 cc per minute. You use needle, approximately 13 mm of the needle is to be used, and to a depth of 3 mm, total flow 90 ml, 1 session per week, total number of sessions is 8. Then in case of you want, if you have to do an episiotomy scar and you have to work on vulva, this is the protocol. I'm not telling you all details because see, these are very much details available everywhere, but yes, they are used on episiotomy scars and they have to be used with a 30 gauge needle with total CO2 inside the patient is 70 ml, only 70 ml, as we compare to that Lapro, it is like in liters. Total number of sessions is, and it is a heated gas. Then these are the dark circles. Then you have the under eye. I'll show you the videos first. Yeah, this is the video. Okay, yes, now I'll show you. This is how the carboxy is placed, under eye. So easily, nicely done. It is hardly 40 to 60 ml or 70 ml CO2 has gone inside, and this has given a bleb. Almost 8 sessions have to be done, repeated. I'll show you again. This is how it is done. So we come back here. Under dark circles, you have intradermal injections, 1 session per month with a flow rate of 20 to 40 cc per minute. 4 to 5 punches are given in the lower orbital area, and sessions required is 3 to 6, and the results are really good. This is about the stretch marks you have. Then this is another, this is for stretch marks. How we are doing it. These are the little blebs over the stretch marks. You put small needle and you actually see results, but it comes after like 5 to 6 sessions. We have a lot of patients with stretch marks. You can actually use them. And it's not doing much, just a small thing, it goes in and that's it. And we don't need to give local also. You can apply a xylocaine ointment or something, but actually not required. I'll finish off and then I'll tell you. Then these are the stretch marks. Look at the difference between the stretch mark. This is a lot of stretch marks and this is all relieved. Then, okay, then for vagina, the flow should be very less, that is 20 cc per minute. You need a needle of 32 gauze. Only depth in which it goes is only up to the bevel. Total flow rate is on the mucosa. The 1 session per week, 8 sessions, and only heated gases use.
Madam has few questions.
So evaluation, visual observation of vulva and vagina, female sexual functional index, female scale distress, pH test strips, and 3D camera, because it targets the hemoglobin and melanin, and intravaginal camera. That's it. Side effects, yes, a few side effects, like you can have little pain, you can have little bruises, you can have subcutaneous emphysema which goes off in hours. An innovative clinical treatment in vulvo-vaginal and perineal area. Lunchtime procedure offers a patient a non-invasive method of improving her vaginal health, sexual satisfaction, and quality of life without need of recovery and downtime. Thank you.
Thank you, madam. It was an excellent lecture. This concept was something new for most of us.
Yes.
So most of us have not used this carboxytherapy. So just wanted to know how you are connecting the CO2 to that syringe.
That's a machine, ma'am, and there is pipe comes out through the machine.
And it's connected to the syringe?
Yes, yes. तभी तो low rate में होता है. I and Dr. Poonam have the same machines. We have bought it from Dubai. We have to have only that, there's a small CO2 cylinder which is attached, that is transmitted through the machine, and to the medicinal, obviously CO2 is to be there, and then the CO2 comes out through a tube. Okay, so that is what is regulation. You cannot give 20 cc or 40 cc or 60 cc. That is the way हम उस पे setting करते हैं. That's on the machine. We have all the settings. I don't have the picture. I'm sorry.
Is it the medicine, same CO2 as we use for laparoscopy?
No, that's a different. Ma'am, do you have a picture? You have a picture? Yeah, please you come.
No, but it's the same.
Because I didn't have a...
It's the same medical CO2 which is in a smaller cylinder.
The same.
And there's an insufflator with a regulator which...
No, that's a different, no. That's a machine is different.
Okay.
Total machine is separate. It has to be a smaller cylinder attached to a machine which is the carboxy machine.
Got it.
Should I show the machine?
Please.
There is a picture.
Yeah.
She must be having because I didn't know.
The medicinal, the quality is the same as what we use for laparoscopy.
Yes.
Only the size of the cylinder is small.
Yes.
Yeah.
मैम आप देखो ना मेडिकल में आप लीटर्स में देते हो 3 लीटर 5 लीटर और आप इसमें 30 cc 40 cc 70 cc दे रहे हो. So there is a difference.
Yeah.
There is a difference.
One more thing I wanted to ask, when you inject it below the eyes and here, any complications to the eyes?
No.
Encountered?
No. Till now I've not.
Because it is so near to the here, it looks so scary if something happens to the eyes.
It's intradermal.
Intradermal. Yes. The person who does should be extremely careful so that they don't go inside or damage the eye, or it should not cause any complications to the eyes. Yes.
It's something so important that only just CO2 gas, which everybody is having CO2 cylinder with them, can be utilized for rejuvenation, the whole body rejuvenation, from scalp to just like PRP, the results are comparable. So I will show my machine, the same machine we both are having. So, and the name I have given, I like this slide, and that is why I'm just showing that waste is the new wealth. Waste is the new wealth. We just exhale CO2 and we are using it. So the results are, this is the way, this is the machine. This is the machine, the lower part is just to contain the cylinder in it.
Okay, yeah.
And the upper part is the medical monitoring of the gas. The flow meter is there just to meter the flow, just a picture, and that is why. And we are using in these ulcers also. That is what I just wanted to tell, such ulcers. And initially it was found that those people who were having venous ulcers, when they used to take bath in the swimming pools with plethora of CO2, they got healed themselves.
Okay,
and then there was the idea that something is there inside these pools, that CO2 is doing some medical wonders, and that is why it is there. So I would like to show one more video that you shown over there. Pardon? I think it is between 10 to 15 lakhs. So, no, it is not available in India. It is very difficult to get. Yeah, we got these two machines. This is the way the tube is there. That is why I am showing. Two outlets are there, A and B. So at one side you are there, other side is your technician can give the machine. And this is the way the ma'am shown, ma'am had shown.
I don't have much experience, but Dr. Poonam has got much more experience than me.
So it just spreads. The gas goes inside. What stretch marks are? Stretch marks are the torn, the skin is torn. The collagen actually is torn in between. So it is just like a polythene you take in your hand and you just spread it. So there are a few wrinkles in between. The gas flows through that, and it is quite visible that it is just occupying the free space, and it works. Results are absolutely permanent, but aging cannot be stopped. So every time the results are there, but stretch marks are very difficult to go. So we get 50 to 60% results in stretch marks. And other things, the panda eyes and, sorry. It is not restoring, it is just tightening the remaining part. The present collagen is rejuvenated and that actually comes nearer. So the stretch marks are actually replaced by the normal tissues. They come towards each other. The hairline scars remain. Those stretch marks remain just like hairline. They are not vanished. The healthy skin comes towards each other. So that the wider stretch marks become narrower. Yes. This is the fact. That is the way it is healed.
Okay. Thank you. Will it help the chronic wound sinuses?
It should. It should.
Maybe chronic wound sinuses, maybe by shrinking, may help.
Yeah, I would like to show the results in alopecia also. Just like PRP, you can get the results. Activation of, see, the PRP also does the same healing process of the body, is accelerated, and the same way. The oxygen content is going more. You are delivering CO2, and in the areas which are rich in CO2, because of Bohr effect, the oxygen is deloaded in those areas. And that is why the healing is more. So, bas. Nice.
Thank you, ma'am. Thank you, Dr. Anupama ma'am and Poonam Mishra ma'am for informative session. Now there will be inaugural session, and Dr. Monica will.
Namaste. A very warm welcome to all the respected dignitaries here and all the delegates. Today we'll start the inauguration. It's my honor to stand before you today to inaugurate this momentous occasion. As we gather here, we embark a new chapter, a new beginning, and a new journey. As we inaugurate this 35th KSOGA State Conference, Cosmetic Gynecology Workshop, we recognize the potential, the promise, and the possibilities that lie ahead. May this inauguration mark the beginning of a new era, an era of growth, innovation, and excellence. May it inspire us to strive for greatness, to push boundaries, and to make a meaningful impact. With a great pleasure, I invite all the dignitaries and delegates to 35th KSOGA State Conference, Cosmetic Gynecology Workshop, and join me to celebrate this momentous occasion. I request Dr. Durgadas Sasrana sir, President KSOGA, and other dignitaries to come out on the stage and light a lamp of knowledge, hence guide us to a path to success.
Shubham Kurutvam Kalyanam Arogyam Dhanasampada Shatru Buddhi Vinashaya Deepajyotir Namostute Deepajyotir Namostute Deepajyotir Parabrahma Deepajyotir Janardana Deepajyotir Parabrahma Deepajyotir Janardana Deepo Hartu Me Papam Sandhya Deepa Namostute सम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापम् सन्ध्यादीपनमोऽस्तुते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं प्रभुरव्ययः आरोग्यं देहि पुत्रांश्च
A very good afternoon to all of you. I am Dr. Pratap Kumar from Manipal. I was the past president of KSOGA, and we did the first KSOGA conference at Manipal. I'm so happy 35th conference is happening here in Durga Prasad's place, Tumkuru, and it's a beautiful arrangement Durga Prasad and his team have done. Sorry, Durga Das has done, and it's an excellent teamwork. Congratulations, and I'm happy to inaugurate this workshop, and we'll have a lovely session today and tomorrow.
Thank you, sir. Thank you.
Thank you all. Now, without further ado, let's move on to our next session. Yes, ma'am. We thank the audience for their patience. This was very necessary to invoke the blessings of the Almighty, though a bit late in the day. We request you all to quickly finish lunch and come back to the same hall for the Padma Rao CME at 2 p.m. and then for the KSOGA convocation in Sabyasachi Hall at 4 p.m. Following that will be the inauguration in this hall itself. Thank you.
Thank you, ma'am. Thank you, ma'am. Now I call upon our next speaker, Dr. Sheila V. Mane, ma'am. She will be speaking about need of cosmetic gynecology in current scenario of obstetric gynae practice. I request chairperson to introduce Dr. Sheila V. Mane, ma'am.
Welcome Dr. Sheila, a very familiar figure not only in KSOGA but also in Foxy. She runs the Anugraha Nursing Home and she works as a professor and HOD at KC General Hospital, Bangalore. And you know she's the PPH Lady of India. She's the ICOG Vice Chair elect and the Vice President Foxy, and she's been the chairperson of the Safe Motherhood Committee. And Dr. Sheila, like me, is slowly moving into newer frontiers, running behind obstetrics. Now we need a little cool-headedness, so we are moving towards, and she has moved towards aesthetic gynecology.
I request audience to focus your attention. We have three very interesting and very topics coming ahead, very necessary for the setting up the clinic. Kindly have your focus.
Thank you. Thank you, and it's nice to see so many people, and thank you Bharti and Kasturi. I think my talk will be just icing on the cake. Okay, everybody has spoken everything. So we know that the women health today extends beyond fertility and disease management, and with the life expectancy going up, more and more people will have these problems. So there is a growing emphasis on quality of life, sexual well-being and self-perception. So cosmetic gynecology has emerged as a response to women seeking physical comfort and psychological satisfaction. So it bridges the functional restoration, aesthetic enhancement and emotional empowerment. Now 50% of the women suffer from GSM symptoms 4 to 5 years after menopause, including dryness, incontinence. In general population of female reported is 13 different studies. Young adults also face 20 to 30%, middle age 30 to 40, and elderly is 30 to 50%. Major issue 80% postmenopausal atrophy and SUI in 50%. 28 million women with urinary incontinence and 15 million women with SUI. And this study was from USA, but I know in India also it will be the same with more population, but we don't have the data, and that is the truth. So latest truth is, according to reliable sources, there are more than 19 crore women are suffering from any of the problem. You must have also heard about the same. There is a change in patient expectations. Modern women expect comprehensive and personalized care. They want to look, feel and function their best in all life stages. They see gynecologists who address concerns related to genital appearance, comfort and sexual satisfaction. Shift from disease-based to desire-based consultation reflects growing awareness. So it is a desire-based. Influence of social awareness, internet, social media have increased exposure to genital aesthetics and rejuvenation options. Open discussions about sexual health are now more acceptable. Women recognize that genital concerns are medical, not merely cosmetic. And this awareness encourages them to seek professional, safe medical solutions. Postpartum changes, a key need, and Dr. Bharti told us that she has a questionnaire. I think that's a very good idea. That could be childbirth can lead to vaginal laxity, perineal scarring, loss of tone and elasticity, and altered genital appearance. And these may cause discomfort, reduced sexual satisfaction. So cosmetic gynecology offers restoration of pre-pregnancy state, improving both function and confidence. Menopause, we already told about dryness, loss of elasticity, dyspareunia, recurrent infection, and that can impact quality of life. So we heard about all the solutions now which we have. Not merely about appearance, function is central. So procedure addresses all the issues we know now. So enhancing pelvic support, improves sexual comfort and everyday functionality. Psychosexual well-being, which is less attended. Genital dissatisfaction can cause embarrassment and avoidance of intimacy. Cosmetic gynecology helps women regain sexual confidence. Improved self-perception translates into healthier relationships. It bridges the physical and emotional aspects of sexual wellness. So self-esteem and body image. So women link genital aesthetics with overall body image. Procedures can help restore confidence after childbirth, trauma or surgery. Enhances feeling of attractiveness and self-worth, and promotes positive mental health outcomes. In fact, I saw one wall, that is the wall of vulva. You know, there are so many different types of vulva, okay, normal, abnormal, like that. Empowerment and autonomy reflects a woman's right to make informed choices about her own body, overcome shame or stigma associated with genital consent, symbolizes body ownership and self-empowerment. It is not vanity, it is visibility of one's needs. So expanding role of gynecologists, they are trusted confidants for intimate issues, and I think by the period of time we are practicing, we are almost like family physicians, particularly to women. So offering cosmetic gynecology allows them to address unmet patient needs, retain continuity of care, combine the medical safety with aesthetic expertise, and expands the professional skill set and service portfolio. Urban may be more demand, rapid lifestyle changes, professional stress and delayed childbirth influences genital health. Urban women increasingly seek regeneration and self-care options. Growth of specialized women's health clinics reflects this demand. So it fulfills both medical and psychological aspects of their needs. Addressing hidden problems, they silently endure dissatisfaction due to social stigma. Cosmetic gynecology provides a safe environment, encourages proactive management of physical discomfort and body image concern, empowers gynecologists to normalize discussions on sexual health, could be post-surgical and congenial needs, post-episiotomy deformities, obstetric tears or FGM scars may persist, congenital asymmetry, so you can do, could be liable hypertrophy, clitoral hood access, causes discomfort or embarrassment. Aesthetic concerns improves both comfort and self-perception, and these are genuine reconstructive, not just cosmetic indications. So, the quality of life improvement, it improves comfort, sexual satisfaction, psychological well-being, reduces anxiety and enhances partners' intimacy, aligns with WHO definition of a state of complete physical, mental and social well-being. Integration into holistic women's health, modern OB/GYN care now includes mental health, sexual function and aesthetics. So, it is within preventive, restorative and wellness frameworks. So promote comprehensive and continuous care across the reproductive life stages. Yes, research and acceptance, evidence shows improvements in all these conditions, growing acceptance among gynecologists and patients alike, and I can see that it is really encouraging everybody and reflects an evolving standard of care. Ethical need and responsibility ensures that care is patient-centered and ethically delivered. They must improve, gynecologists must improve accurate information and realistic expectations. So counseling plays a very important role. Avoid commercial exploitation or unnecessary procedures. I think most of the time we do consider our patients, okay, depending on their paying capability. Ethical practice enhances credibility and patient trust. So future outlook, rapid advancement in lasers, RF and regenerative medicine, integration with PRP, stem cell, AI-based evaluation, cosmetic gynecology expected to become a mainstream part of women's wellness program. So there is a need for structured training and national guidance, which is important. So in conclusion, it fulfills physical, emotional and social needs, empowers women towards confidence and body control, and represents modern, compassionate OB/GYN care. So I take this opportunity, we are conducting a workshop in Bangalore in Anugraha Nursing Home on 8th and 9th, and we all have again faculty like Dr. Poonam will be there and Dr. Vidya Pancholia, and all whatever you have seen today, hands-on training will be given on 8th and 9th at Anugraha Nursing Home in Bangalore at my place. Thank you very much for your patient hearing.
Thank you, Dr. Sheila, for mentioning the unmet needs of aesthetic gynecology and the newer frontiers in management. And I'm sure all of the delegates will definitely look into this field, which I would not say is not a specialty, but it has to be a part of your regular gynec armamentarium. Thank you.
Like how we said that ultrasound has become right hand, now both the hands can extend more holistic approach to women's health.
And similarly, you mentioned urban. I would like to say, me coming from a semi-rural area like urban and rural, the awareness, once we talk to them, many of them are coming back for therapy and they are very satisfied. So it doesn't, I think a woman in Bangalore and a woman in Hassan or Ilkal doesn't make a difference. She definitely is bothered about the lower part of her body.
if we make her aware that that we can give her comfort.
Because they think there's no treatment, it's just part of the aging process.
One of my young patients, when I told her, oh, many women, she said, no, nothing more. Nobody hesitates to talk about these problems. We are all open. Okay, so the young population is more open about it.
In the past, only people used to think of beauty of face. Then they started thinking over the body. But now the present generation, beauty of bottom. So they think of that.
Overall, okay, empowerment. Thank you.
Thank you, Sheila ma'am, for informative session. I call upon Dr. Gnaneshwari to talk about economics in aesthetic gynecology clinic setup.
That's not right. That's not my.
Only the name is Dr. Gnaneshwari, the rest of it belongs to Dr. Shobha.
Yeah.
There's a confusion in the bottom of the slide.
Can I change it? It's not changing there? Okay. Can I come to the slideshow? Yes.
Let me begin by thanking Durgadas sir, the whole of KSOGA team for giving us an opportunity to be here. Vidya ma'am for recommending me as always. Bharti ma'am and Kasturi ma'am for sitting through the session. I know it's difficult, but they're there. And the Tumkuru crowd and the rest of the Karnataka crowd for being there for the talk. Since morning we've been listening about cosmetic gynecology everywhere. So today now I've taken it upon me to realize, I guess Pune ma'am and Anupama ma'am will guide me more about this as to how to monetize it and how to get it into our practice. So the topic of today's session that I have been the economics behind an aesthetic clinic. I'm Dr. Gnaneshwari TL from Bangalore. I'm basically a laparoscopic surgeon and also new into cosmetic gynecology, a vice chair in KIGE and an EC member of BSOG in the current year. So now, as ma'am was telling, just when Sheila ma'am concluded her talk, cosmetics and aesthetics is a business of looking good and feeling good. So you should first identify your target customers. Or they have told you Ilkal to Tumkuru to Hassan to Bangalore, it's no longer a matter of region, it's just a matter of awareness. So understand the ground realities and you focus accordingly. So from a tired gynecologist there who's looking at a patient after a busy delivery, you have to start looking like the other person. That's going to be your first change before you get into the cosmetic field. So the next thing, what do? You change your appearance, so now you're going to go on investment in training. You have many people here who have cosmetic gynecology training that is running. Good hands-on training, decide your center according to the money and also the hands-on experience you're going to get it. You should choose a center which they teach you easy techniques which are easy to learn and replicate in our day-to-day practice, where no high degree of skill is needed. So you train at a place which gives you practical tips and hands-on. Next comes the most important thing. You are going to invest in your equipment. So here, right on your stage, you have, I think the whole thing is going to come up to 2.5 crores, ma'am, if I am not mistaken. The Haggard people can guide you better. If you're going to put into all of this, it's going to come, even only the machinery might come up to 2.5 crores. Yes, so you have to see how much you're going to invest and what is the return on investment. So accordingly you invest. I think the chair that they are promoting is around 22 lakhs, if I'm not mistaken. You have chairs from various other companies, but I think this chair costs you around 22 lakhs. Yes, no ma'am, 22 or 25 lakhs. So this doesn't come cheap. Yes, you cannot charge exorbitantly to your patients, but still you can make it cost effective. That's how you have to do your practice. So you'll need what are the basic things you need? You have a PRP centrifuge machine. Most of the laboratories have their own centrifuge machine. That is going to be good enough to do your PRP preparations also. Of course, you need a technician who's going to you're going to train your technician to do isolate PRP. Then the consumables, the test tubes, the syringes and the needles and the threads. The threads also don't come cheap. Each bag of threads comes around 2,000 to 2,500 to 3,000 there. The OT light and the examination table you'll be already having, but you can't take them to the OT for all these procedures. You're not going to
put the patient into a sterile gown. So you will have to have a dedicated area in your clinic or in your practice where you're going to have an examination table, which can be an OT common examination table, a gynecological table rather. Then of course lights, then pelvic muscle strengthening chair, the chair that's there, and of course the laser machine. The HECA people have come up with a new Adolf laser, which is supposed to address a lot of our pelvic, this one. And once you decided on your investment on your machines, the next thing I told you, cosmetic is about always looking good and feeling good. So you have to invest in the ambience of your clinic. So ambience of your clinic can run anywhere from 5 lakhs to 10 lakhs to 70 lakhs as to what you are already having. You'll have to enhancing and make it aesthetically pleasing to look at. You have to have a screen that will keep them occupied and then also can be used for marketing. If you're not good at counseling, keep putting these videos on the screen that will be playing for those patients, for your targeted patients, for patients who come into postpartum clinics, postpartum checkups. Those are the patients that we are going to initially target, and also the postmenopausal women, who the mothers and the mother-in-laws who are going to come with your delivery patients. Most of them will be having stress urinary incontinence or urge incontinence. So please keep playing those videos in your OPD rooms. That will help generate a patient load from already existing clientele. A private and a dedicated space for your cosmetic clinic. Don't run it simultaneously with your gynecological OPD or an obstetric OPD. Keep a dedicated cosmetic time slot for your patients where they can come, book book an appointment and come to you. You also will have time to dedicate your time to this routine, because this doesn't require too much of your knowledge or your skills here. You just need patience, you just need to examine the vulva in a different way, and you need to counsel the patients. An investment in marketing, pamphlets, handouts, digital display, standees with necessary material, ads in newspapers and TVs in compliance with the local rules. Now everything is social media. Rather than that, I think social media will work wonders for you. In our Bangalore too, it definitely works wonders for you. I don't know about Hassan and Ilkal. Yes, digital era reckons media presence, understand the unique services and the opportunities which would create a strategy tailored to your goals, provide educated content for the patients. In another very important, providing them is a very important factor. You create a pleasing and informative web page, Google searches, YouTube videos, Facebook Reels, Instagram scrolls. None of them come cheap. Facebook Reels and Instagram scrolls maybe, but YouTube, Google searches, everything comes at a cost. And give them realistic appearances. Don't tell, this is what is cosmetic. See the way from Rekha from 1967 to 2025. She looks better, I guess, from what she was looking in 1965. So this is how you should learn to market. The best way to do this is give client testimonials on your social media pages. The new trend now is you're hiring influencers everywhere. So you can hire influencers to do it. You've done all of this, patients have started coming, now what are you going to do? How are you going to convince them? So you have to motivate your staff now. You have to educate your staff, the patients, the staff, the receptionist, the staff, sister, whoever is there with you, to counsel the patients and convert them into, not OT conversions, what is this, ma'am? Gynecological table, cosmetic conversions.
Aware of their body, so that they have a better functionality and better aesthetics.
So you how to turn online inquiries into booked appointments, learn how to handle online leads effectively, because most of our reception will be saying, Madam ishtotige irtare, amel banni, all those things, avella illa. You have to talk to them properly, give them proper appointments. So you have to dedicate the time for your cosmetic gynecology, then you have to build a team to handle all of this. So always prioritize patient safety and well-being before you start doing anything. Be compliant with all the rules and ethical rules whenever you're doing the marketing. Make sure to highlight that if there is any risk factor that is associated. You think nothing happens. I have injected an intrauterine PRP for a patient who was having a thin endometrium. And I don't know if she went into vasovagal shock or if she went into hypersensitivity reaction. She had severe painful cramps, her BP started crashing, tachycardia, everything. So now I've decided whatever PRP, I do it in my OT table or wherever there's a pulse oximeter there. I have a atropine and a hydrocortisone and a diclofenac as a standby. This is what I've experienced in the limited experience of 1 year of practice which I'm doing for cosmetic gynecology. She went into sudden vasovagal shock. So be there, we keep all the equipment that is necessary. Patient compliance, patient safety should be of paramount importance. And utilize before and after photos of the patient responsibly, ensuring that they accurately represent achievable results rather than showing unimaginable results. Thank you for your patient hearing. I want to conclude with this. I've been there since, I've seen Donimat Madam for 20 years ago. I've seen MG sir 20 years ago. I've seen Pratap sir 20 years ago. They all look the same. Maybe we should learn how to look aesthetically and cosmetologically better with them. Follow their diet plan and look the same rather than doing all of this. Thank you for a very patient hearing. Thank you.
Thank you, Gnaneshwari ma'am, for enlightening about...
I think the legends of KSOGA are rejuvenated by the Almighty himself.
Oh yes ma'am, they look the same. I've seen Donimat ma'am when I was doing my undergraduate. She's the same ma'am, she's the same. She's not changed a bit.
No machines.
So the investment, I would say, the concluding would be anywhere range from 20 lakhs to 2.5 crores. So invest wisely. Hope all of you do well in cosmetic gynecology and take it up intensively. Thank you.
Thank you, Dhanashri. I encouraged many people to start up with the aesthetic clinic. It is, they have to think, because they know practically how they can know. At least they can start with simple things, then they can upgrade. They can start with PRP and then threading, all those simple procedures. Then they can go to the higher ones. Thank you for an excellent talk. Thank you.
Thank you, Gnaneshwari ma'am, for enlightening on economics, which is very important topic. I have an announcement to make. Anybody interested in having a look at these machines, wanting to have a chair, and also very interesting offer by Haggars. Anybody wants to get cryolipolysis done or laser hair removal done, can visit stall number 4. Isn't it very attractive offer for all the ladies, isn't it? And now we know PRP is the queen of all aesthetics. I now call upon our next speaker, a young sparkle, Dr. Priya Patil, to deliver the topic on deliver her talk on PRP. Kindly be seated, all of you.
Welcome, Dr. Priya. And she is a gold medalist from Manipal University, and she's got a fellowship in cosmetic, aesthetic and regenerative gynecology. But she is well known to us as the daughter-in-law of Dr. B. Ramesh, the legendary laparoscopic surgeon of India. And she is working in Altius Hospitals, which is owned by the family. She's a teaching faculty in AAGL and RGHS recognized MIS training programs, that is minimally invasive surgery programs. She's got various awards and she's written a lot of publications. So over to you, Dr. Priya.
Thank you so much, ma'am. First of all, I would like to thank the people who have provided this opportunity to me. To be here and talk to you about liquid gold, that is PRP in gynecology. Now those who have already been shaken hearing 2.5 crores by Gnaneshwari ma'am, after this topic I would assure you that you can become a gynecologist. You're already a gynecologist, you can become a cosmetic gynecologist also and start practicing it with no cost, no extra cost. Because I'm sure most of us are doing IUIs in our practice here. Can I see a raise of hands who all are doing IUIs? So all of us will have a PRP machine, correct? So why is PRP so important and so widely used? Because it is of the cost effectiveness and also minimally invasive techniques. Now women get scared because if you tell them surgery, ವಾಪಸ್ ಮತ್ತೆ ಬರೋದಕ್ಕೆನೆ ಟೈಮ್ ತಗೊಳ್ತಾರೆ. They probably might not come back also, and especially when you talk saying that okay, I will do a surgery or I will do laser. Yeah, counseling plays a very important role in cosmetic gynecology. So people will be scared, but if you tell them that these are your own cells, we are putting it there, to improve the functionality, the appearance, they will be more accepting of it. A small line I tell my patients, I tell them, if you get a cut on your hand, how does body know that the skin has to be regrown on that area? It is the growth factors, it is the platelet rich plasma which comes there and then activates and regrows that skin there. Similarly, when that potential can be used for another area where there is a disease or to improve the appearance or to improve the functionality of that area, the acceptance gets a little better. Okay. So why do we call it as a liquid gold? Because it looks yellow, it is rich in growth factors and cytokines, and it is an autologous concentration of platelet plasma. What are we doing here is we are increasing the baseline concentration to 3 to 5 times more to utilize it. What is the mechanism of action? These have alpha granules which disintegrate to release lot of growth factors, which indeed promote angiogenesis, even cell modification, cell migration, collagen synthesis, neoangiogenesis and neural modulation, which improves the tissue healing, vascularity and sensitivity. How to prepare? Like I said, you don't need any expensive machine, or you can already use what you have. These PRP tubes are easily bought in Amazon. Okay, it hardly costs you 200 rupees. So go on your Amazon, you can order these PRP tubes. I would recommend an ACD tube because you need an anticoagulant. Imagine that is also not there. Now what we are, Indians are known for our jugards. So what do? Take a tube, put 5,000 units of heparin and put blood, and there it is, ready to, centrifuge and ready to use, right? It is as simple as that. You need a tube, centrifugal machine which is already present in your clinics because you are doing IUIs. You need insulin syringe, sterile gloves, and there you go. You are ready to do PRP and you are already a cosmetic gynecologist. So 30 ml of blood can give us a good concentrate of 3 ml of PRP that can be used effectively. You need centrifugation. Double spin is preferred over the single spin. So you do 1500 RPM for 15 minutes. You take the buffy coat and again do it for 3500 RPM for another 10 minutes. Then you get a platelet pellet and the plasma. You can discard 2/3 of the plasma. Using the 1/3 of the plasma, when you shake, your platelet rich plasma is ready to use. I would not prefer throwing away the 2/3. You can use it. It is actually a platelet pure plasma. You can just use it, or for topical application, just over the surface, you can use it also. And this has to be extracted in sterile conditions. So this is how your platelet rich plasma is going to look. What are the applications in gynecology? See, people who want to practice cosmetic gynecology separately, you might find very few people like that. Cosmetic gynecology is itself a misnomer. It is just not cosmetic, it is functional. So if you inculcate all these things in your practice, then your practice is already better. You have to identify and you have to have the eye for recognition of problems in women which we have been ignoring from decades. If you're examining, you do a per speculum examination, do assess how deficient her perineum is. Is there vaginal laxity? It is just not for sexual satisfaction. Vaginal laxity will also lead to vaginal prolapses later on in this thing. So when you identify it early and you guide her in the right direction, you can prevent surgery in the later stage. So genitourinary symptoms of menopause, GSM, it is widely used. Vaginal atrophy, dryness, stress urinary incontinence, vulvodynia, lichen sclerosis. In aesthetic and sexual health, obviously vaginal rejuvenation. You can also use it for O-spot and G-spot augmentation, enhancement, and also increasing the sensitivity of these areas. Fertility, we have already accepted it for endometrial rejuvenation, or ovarian, I would not say that it has best results, but it is still, we need to still progress. We need more studies to prove that it has good benefits in the ovarian PRP, but endometrium, excellent results in recurrent pregnancy losses and in recurrent implantation failures. So local anesthesia, you don't even have to inject. There is a Prilox jelly which comes. You have to just apply a thick layer of Prilox jelly wherever you're injecting. And insulin syringes are mosquito bites. Again, how to convince the patient? Tell them a diabetic takes these injections voluntarily 3 times a day. And when I am doing it, to you once, that to applying an anesthetic cream, it should hardly hurt. So it is a painless procedure. You can use it in the intravit. You can inject it everywhere in the body. every specialty is utilizing PRP. Companies are coming up with already prepared PRP kits. Orthopedics, they are coming up with these kits which are readily available. You can just inject. So that way you don't even need an IUI machine also. Now you can just buy it and start injecting these. They are also enriched with growth factors. Merrill is one company which is coming up. It is going to come because this is the need of the hour, and pharma companies are not going to lag behind in utilizing an opportunity. And intrauterine infusion in the subendometrium can be done, and also you can do a subendometrial injection through the hysteroscopy. You can also inject it directly into the O spot and G spot. I will be covering more of the cosmetic part in this lecture. So G spot augmentation, you cannot use the words G shot and O shot. They are patented and you can be sued if you use those in your clinical practice. So please be careful. So you can use other words called G spot augmentation or O spot augmentation. Now what is G spot? G spot is already a structure which is present in the female vaginal wall, which is there in the anterior vaginal wall. So when you take your fingers and go 2 to 3 inches inside and palpate, the maximum rugosity you find, or the area that is very sensitive when you palpate or press, is the G spot. In some women it is more pronounced than the other, and that is why the PRP comes in action. People who want to enrich their experience can inject, you can inject it into the G spot. There are also hyaluronic acid fillers which can enhance the surface area also of these spots. What is O spot? It is the orgasmic spot. We all know that clitoris is an organ, but did you know that clitoris is a huge organ? It is not just the dot you see from the outside. It has bulbs, it has the crus. So when it gets erect during the act of intercourse, it enlarges, it has the capacity to enlarge entirely. So you can inject around the clitoris of 0.5 ml and around the bulb and body of the clitoris and inside of the vagina. So combined, this is called O-spot augmentation. Now will this work with a woman of such a bad laxity? If there is a 4-finger loose vagina, if you inject PRP, is it going to help? Definitely no. So patient selection is key in understanding or giving the results that patient desires. Otherwise you will get a bad name and everybody says it doesn't work. Even you will think, oh, it is not working. People are just coming and speaking like that. No, you have to identify the patient who is suitable for what kind of treatment. So in this case, what I have done is, you can also see that deficient perineum. This lady had given birth to 4 kids vaginally, and the perineum was very deficient. There was some amount of cystocele and rectocele. So we have done perineoplasty first, that made it 2-finger tight, and at the same sitting I had injected. She did experience very good results, and after which she wanted to increase her experience because husband said, more tight or whatever it is. Then I asked her one question, leave the husband aside. Do you want to do something? It's for you, it is not for the husband. So she said, thoda behtar hota to acha hota. Then we have taken her up for laser. So it's a combination of things. One thing cannot do the complete magic, but it will definitely help. What are the advantages? It is autologous, it is safe, it has low immunogenicity, minimally invasive, quick office procedure, 10 minutes procedure. Patient can go back home. There is no admission or whatever is required. And synergy with laser or energy-based devices gives better results. Limitation, there is lack of standardized preparation techniques. Now I am telling one technique, maybe some other obstetrician who is practicing might tell another technique. So we need more RCTs to prove, and variable patient satisfaction. One patient can experience very good results, the other might not experience that much results for the same technique used. So patient satisfaction is variable in this, and you might require multiple sessions. What are contraindications as such? Lactation and pregnancy. I would not recommend you do any of these procedures for women who is carrying or lactating. active skin infection, if there's underlying sepsis and abnormal platelet function, because we are utilizing the platelet function here. If people are on any anticoagulant therapy, ecosprin 75-150 is okay, but if they're on major anticoagulant therapy, would not recommend. And severe systemic disorders, because that is the primary aspect and this takes the second seat. Safety wise, it is extremely safe. You can inject, you cannot, nothing can go wrong in this procedure. So there are only two effects, either it works or it doesn't affect. There is no other side effect is what I would like to say, but very minimal. Some people can experience headache, chills. It is very rare, and pain and bruising at the site of injection. What instructions to give is avoid rubbing and massaging for 1 day, avoid intercourse and swimming for 2 days. Are we just speaking like that, or is there any evidence? Because we are evidence-based practitioners. Of course, I had to get you some evidence. So in GSM and vaginal dystrophy, there is something called as VHI scores. That is the Vaginal Handicap Index or Vaginal Health Index, which is a questionnaire provided to women to assess what is the improvement after these procedures, and women have given reviews that it works really well. So these are all published studies. In stress urinary incontinence, PRP does help in minor. If it is a severe stress urinary incontinence, please take her up for native tissue repair, or you can put a tape. For first and second degree, SUI, yes, all this can be tried. For lichen sclerosis, excellent results. Intraovarian PRP, mixed, needs more evidence. Endometrial PRP, personal and experience of others, again, very good results. So, anywhere else can you use it? Of course, for a scar. Can you see, this is a 7-day-old scar, which you can see even the sticker still there. Can you see a LSCS scar here? You can't. The concept of this is you have to deliver what the patient requires from you. In most of the medical colleges and everything, the lowermost, the inexperienced junior most resident closes skin. The main thing is uterus closure, everything, the senior surgeon scrubs out also and goes. Does the woman really see how her uterus is closed or what it is? For her, yes, scar is important. We can just push it away or brush it away saying that it is just a scar, it is okay. But that is important to her. And as doctors, our primary intention is to understand the patient emotions and deliver what the patient needs. So please, if you spend a little more time on this scar closure or while you're doing episiotomy, then their life will be much better and their confidence will be better than what, having a bad scar looks like, right? And many of them will undergo repeated cesarean sections now. So it is our duty and responsibility to make sure that she has a beautiful scar. One tip is you can change from using a monocryl 30 to 40. It will take a little more time, but closure again is really, really good. And amniotic fluid can be used to enrich this scar appearance. If you see not in all patients, if you see a patient has already a keloid formation or a hypertrophic scar which has not healed well in a lap surgery or whatever, you can put amniotic fluid. Just take the amniotic fluid, preferably without blood mixed. If it is blood mixed, run 1500 RPM of the amniotic fluid, and after you close, you can inject it using an insulin syringe or just apply it over the scar and put a bandage. Also has been giving good results for me. What is the future? Combined therapy is the future. PRP, laser and PRP with the chair, which improves the perineal muscle strength. Again, we need standardized protocols and RCTs and long-term safety and efficacy studies. To summarize it, you can use PRP in everything that is possible. There is no major side effect, and it is such a low cost investment, and also for the patient it costs very less. Only key is patient selection and realistic expectations. So it is a transformative change in the regenerative medicine, needs more robust evidence, but offers a safe, minimally invasive and regeneration potential. Thank you so much.
Thank you. It was very nice, very practical lecture. And I think everybody can start doing PRP. Don't need much investment, or from next day only after you go back, you can think of using PRP for so many conditions. Thank you for stimulating so many minds. And one more thing about Dhaneshwari I wanted to tell. that Rekha's picture you have to put, so more people will get stimulated to undergo aesthetic this thing, that how she was in the past and now she's looking more beautiful. So if you undergo aesthetics procedures, if you look so beautiful, then everybody will come for those procedures.
No, I think Rekha has one more plus point. She's a single woman. She's got a lot of time for herself. No, but still you have a lot of headaches.
Thank you, Dr. Priya Patil. Thank you, Chairperson. We'll be winding off the session with short vote of thanks.
Can we request? No, we request. No, flight has landed. You may remove your seat belts now. Captain has given the signal. I request all the faculty members and the organizing committee to kindly come over the dais for a group photo.
Short vote.
So thank you for the safe landing of the Boeing 747 of Tumkuru.
Workshop, I would like to express our heartfelt gratitude to everyone involved. To our esteemed speaker and chairperson, thank you for sharing your expertise, experiences and knowledge with us. I thank organizers, facilitators and supporting staff for your tireless efforts in making this workshop a success. Thank you one and all. Let's proceed to lunch. And we'll meet again at 2 p.m. for Dr. Padma Rao CME.
Badwe.